Okay, we're live. You can go ahead, Mr. Chair.
Okay, thank you. So I call to order this meeting of the University of Minnesota Board of Regents. Good morning to one and all. Thank you to those who are joining us via the live stream video. As a reminder, Minnesota open meeting law provisions allow us to conduct meetings by electronic means under circumstances like those that we find ourselves in. We had a very full slate of committee meetings yesterday. I think we're in a good rhythm, but for Regents, just a very quick refresher on our meeting protocol. Once again, all votes will be recorded by roll call as required by the open meeting law. For any action before us today, Mr. Steves will take the roll. At the start of each discussion, I'll call on each Regent for their questions and comments. I'll do this in alphabetical order, but maybe change it a bit from time to time, probably using the Macmillan model of yesterday. I'll move one name up. If you don't wish to speak, you're welcome to pass. I'll use this system only once per agenda item. If you have a comment or question that you believe can't wait until your turn in the alphabet, or you wish to speak a second time on a topic, please use the raise hand feature within Zoom or alert Jason Langworthy via text that you wish to speak. Staff will keep a speakers list for me. Please don't talk over others or jump in without being recognized. Regents and presenters will be muted until I call on them to speak. Please do not mute or unmute your line. Staff will handle that for you, and allow a brief pause after you're called on before you start speaking. Finally, I'll remind everyone that although we can't see our audience, today's meeting is live and open to the public via a live stream video, and it will be archived on our website for later viewing. So with that, we have a full agenda, and let's get going. First item of business is to approve the minutes from our March and April meetings. In the interest of time, I won't go through the entire roster for discussion on the approval of the minutes. If you're interested in asking a question or making a comment on the minutes, use the raise hand feature or alert Jason. Is there a motion to approve the minutes?
So moved.
Is there a second? Is there a second?
Second. Yes.
I hear a second. Moved and seconded. I'll pause momentarily to see if there are any Regent questions or comments. I don't hear any, so with no questions or comments, Mr. Steves, please call the roll.
On approval of the minutes, Regent Anderson.
Yes.
Regent Anderson votes yes. Regent Beeson.
Yeah.
Regent Beeson. We'll come back to Regent Beeson. Regent Davenport.
Yes.
Regent Davenport votes yes. Regent Herr.
Yes.
Regent Herr votes yes. Regent Hsu.
Yes.
Regent Hsu votes yes. Regent Kenyanya.
Yes.
Regent Kenyanya votes yes. Regent Mayron.
Yes.
Regent Mayron votes yes. Regent McMillan.
Yes.
Regent McMillan votes yes. Regent Rocha. Regent Rocha.
Yes.
Regent Rocha votes yes. Regent Simonson.
Hold on just a minute.
Regent Simonson.
Yes.
Regent Simonson votes yes. Regent Swigum.
Yes.
Regent Swigum votes yes. Regent Beeson.
Yes.
Regent Beeson votes yes. Chair Powell.
Yes.
Chair Powell votes yes. Mr. Chair, there are 12 yes votes and 0 no votes.
Second, can I give you credit?
By a vote of 12-0, the minutes are approved. Thank you. Let's move on with in the agenda now. Our next report is that of President Gable. President Gable, the floor is yours.
Thank you, Chair Powell, Vice Chair Swigum, members of the board. It's very nice to see you virtually, and I hope that all of you and yours are healthy, safe, and well. It does feel like a lifetime ago when we were together in person for the March board meeting in Duluth. And since that time, the world's changed a lot. We've made many interim reports since my last president's report to you in March, but even so, there are many updates about which I want to make you aware. Members of the board, as academic as well as business leaders, we've been out in front addressing the immediate challenges of this pandemic, making informed and consulted decisions to keep our university community healthy, safe, and well during this challenging time. We're leaning into data, our experts, and our expertise, like the new April 30th CIDRAP Viewpoint report that offers insights on the depth and potential length of this disruption. We're very lucky to have world-leading experts on infectious disease, and in particular this pandemic, like Dr. Mike Osterholm and his colleagues in CIDRAP, our colleagues in public health, medicine, nursing, and across the health sciences, who speak with us regularly, serve on our advisory committees, and generally make themselves available for consultation to us, the state of Minnesota, our colleagues, and across the nation and around the world. We're leaning into the shape of our recovery through detailed mapping of financial consequences and potential reopenings. You heard a projection of the financial consequences yesterday. The reopening is a plan that we're calling the Sunrise, that we're doing through scenarios to return to our discovery, teaching, and service missions as quickly as possible, as it is safe for us to do so, as information evolves, the virus evolves, and its effects become clearer. We're pushing ourselves and our university family to ask tough questions around our uniqueness and our value, and to look around corners for solutions to the challenges that we face. And to this end, we're reimagining what the next normal will be, and the opportunities for the university to not only advance our 170-year legacy, but also navigate new ways for our institution to reinvent itself. It's an interesting challenge, as crises normally present themselves with a prepare, respond, recover timeline, but this one is more of a loop, borrowing from the military OODA loops of observe, orient, decide, and act over and over again as new information becomes available. Central to all of this work are the representative work groups whose principles you approved at the April 21st specially called meeting. These two groups are meeting regularly and making progress in their work to make recommendations for us to consider at the June board meeting on finance and operations, and also on our larger academic and research mission. You've heard some of their preliminary recommendations yesterday, from the necessity of furloughs or cuts that in most cases would be weighted towards those who earn the most wherever possible, in order to avoid layoffs or other more permanent outcomes that could harm our most treasured asset, which is our people, to employing our reserves in this extraordinary circumstance, as well as our genuine commitment to best serve our constituencies in the face of losses that could range, as you heard, from 80 million to well over 300 million. I want to express my appreciation for the continued feedback the work groups have received from across the university, including the approximately 1,000 suggestions received to date in response to a system-wide email sent on April 27th by the Finance and Operations co-chairs, Senior Vice President Brian Burnett and Interim Vice President Ken Horstman, who've been seeking the collective creativity and wisdom of our community for ideas on how to improve our fiscal efficiency, which they will then channel into the committee work and the expertise represented there. Our academic and research committee will be similarly seeking input, so if you're interested in providing suggestions to them, stand by for that outreach. And in addition, Provost Rachel Croson has stood up a fall planning group that has representation from faculty, staff, and students, as well as our CIDRAP expertise, in order to come up with multiple scenarios for our fall planning, as she described to you in her report yesterday. Members of the board, I look forward to keeping you apprised of this important progress as we map towards our future. In other news, plans are underway for a large system-wide virtual celebration for all spring 2020 graduates on Saturday, May 16th. This will be fully online, can be viewed at any time and from any location, and will provide each and every one of our graduates a personalized experience to recognize their accomplishments. The theme for this spring celebration is Hail to Thee, a reference to our alma mater and Minnesota state song, and was chosen to reflect our admiration for the class of 2020's incredible resilience in these really unbelievable times. On March 30th, we officially welcomed Dr. Rachel Croson as our Executive Vice President and Provost, and we got to meet her officially yesterday. She has hit the ground running, with great appreciation to Karen Hansen, who has been the angel on her shoulder supporting her through her transition, and has engaged in the work related to all of the work that the Provost Office does, in addition to the work related to the pandemic. including serving as co-chair for our mission-focused representative work group, expanding our summer course offerings, which include new, timely, system-wide courses on topics related to the times we find ourselves in, regarding the environment, economics, healthcare, politics, technology, and more, in addition to arranging additional support to back up our excellent academic technologists, faculty and staff, and everyone involved so that we could scale our capacity for the summer and ensure absolute top quality for our student experience. We've canceled all summer non-curricular events for May and June unless they can be offered online. Decisions for July and non-curricular events will be evaluated in the coming weeks, as will our decisions around the fall semester, which you heard about in various reports yesterday. Our earlier decision to cancel all non-essential university business travel, both domestic and international, has been extended through June 30th, 2020. But last week, in consultation with orders from the governor's office, we were able to reopen the Minnesota Landscape Arboretum and the Les Bolstad Golf Course, initiating the first phase of a sunrise plan that slowly and carefully reopens some very limited university functions and gets a few of our employees back to work, and the university on the first small incremental step towards its next normal business operations. Some functions simply can't be done from home, are critical, or on a limited basis may be more productively executed from campus. And to determine which are which, we've set up a 3-step process where requests are reviewed and responded to within 24 hours, and those approved may begin reopening the requested function in accordance with guidance provided by the Minnesota Department of Health and the Governor's Office, with a keen focus to ensure the health and safety of our students, faculty, and staff. We anticipate the next phase, 2.0 of the Sunrise, will include the return of more university employees to work across our campuses. Any such decisions will also be made in accordance with guidance from the state and our experts, and with distinct emphasis on health and safety. But most importantly, though, I want to underscore that at this time, if our university employees are able to work from home, they are expected to continue doing so, as the stay-at-home order is still in effect. The third part of the Sunrise Plan will be addressing the scenarios and suggestions for the fall term that the provost referred to yesterday. And all of these ideas and proposals will be brought forward for your review as the circumstances evolve. On April 28th, I briefed virtually the House and Senate Higher Ed committees on the university's response to the COVID-19 pandemic and the financial impact of the challenge, including how those challenges only accentuate how important state and federal resources are for the university, and how a robust bonding bill from the state becomes even more important than before. To this end, I'd like to thank Chair Powell and Vice Chair Swigum for their recent joint op-ed in the Star Tribune amplifying this important message. Members of the board, yesterday you heard about the CARES Act, the federal stimulus, from which the university will receive $36 million approximately, of which half will go to our students. Work is underway across the system to develop a process to distribute these funds to our students, as well as plan for how the remaining funds would impact the university overall, and we will discuss this later today. In addition, and with thanks to the University of Minnesota Foundation and the generosity of our supporters, a student emergency fund was established, and across our university system, nearly $450,000 in emergency funding has been awarded to over 700 students. That process is ongoing, and we look forward to continuing to assist our students as more resources become available and as the requests continue to arrive. With regard to our search for the VP for Student Affairs, we have paused that search until further notice, with great thanks to Interim Vice Provost for Student Affairs and Dean of Students Maggie Towle for her commitment to continue to serve in the role, and to Vice President for Equity and Diversity Michael Go and College of Education and Human Development Dean Jean Quam for their work in co-chairing the search committee. We've also paused our plans to convene a mental health summit with our colleagues at Minnesota State on May 14th, as well as our Minnesota private university and college counterparts. Our work on mental health continues, including our review of the environmental scan, and we look forward to sharing that with you and updating that progress with you so that we can explain how we've maintained access to mental health services during reduced university operations. But I would also like to acknowledge that May is National Mental Health Awareness Month, and now more than ever, it is so critical to bring awareness, support, destigmatization, and education to our entire community about the effects of mental illness and mental challenge, and to offer our sincerest thanks and gratitude to all of those who are providing support for our university family and all of the constituencies that we serve. As part of the administration's work to fulfill the board's charge from April 2019 to develop ongoing commemoration and educational activities that reflect our complex institutional history, we look forward to bringing the Governance and Policy Committee an updated renamings policy draft for consideration and discussion in June, based upon broad, informal, and formal consultation, which has continued uninterrupted despite the challenges presented by COVID-19. In addition, later in this meeting, you'll be hearing an update on our system-wide strategic planning efforts, which have been similarly ongoing and consultative during the challenges we are undertaking at the moment. Members of the board, over recent special board meetings, I've updated you on how, to a person, our university family has merged its talents and resourcefulness to uplift our university, serve our state, and impact the world. Late last month, the university was asked by Governor Walz and the Minnesota legislature to begin testing, in partnership with the Mayo Clinic, up to 20,000 Minnesotans a day for the presence of COVID-19. We are thrilled and honored to be doing our part using science and research solutions developed at the University of Minnesota just over the last few weeks. We're capable of not only protecting the health of our communities, but accelerating our recovery, and we are humbled to be able to do so. This example, as well as countless others, like a $2 million gift towards this effort from 3M, or the Hormel Foundation's recent $1.5 million grant to support a feasibility planning RFP for the CFANS-led initiative Farm, Future of Animal Agricultural Research in Minnesota, or CSE's Nabir Sarma winning the College Jeopardy Championship, or our very own University of Minnesota Duluth's Scott Perunovich winning the Hobie Baker Award. And last but certainly not least, a record 5 Gopher football players being drafted in last month's NFL draft. We are UMN proud. Members of the board, it's been an eventful series of weeks. I've appreciated the many meaningful opportunities to hear your perspectives, as well as those from across our university community. From our 3 special COVID-19 related board meetings last month, virtual system strategic town hall with the Crookston, Morris, Duluth, and Rochester campuses, to consultative meetings with representatives from our labor represented civil service and P&A employees, university senate and student senate meetings. And as we look ahead, we will continue to anchor in what the university's first president, William Watts Fowler, described in his inaugural address as the core of higher education, to inform, inspire, and elevate communities. And as President added, it is hope, not memory, which inspires our hearts and dictates our utterances. To this end, I am not only hopeful, but confident that we will emerge stronger and that our university's best days lie ahead. Thank you for all you do for the University of Minnesota. That concludes my report, Mr. Chair.
Thank you. Thank you very much, President Gable. We'll now move to my report. Typically, when we meet in May, the board takes time to recognize the faculty, staff, and students who have earned esteemed honors locally, nationally, or internationally over the past year. And although we aren't meeting in person, I do want to take this opportunity to celebrate these significant accomplishments. The individuals that we would have recognized at an in-person meeting are listed in the meeting docket, and they're also honored on a special page on the Board of Regents website. This is just a sampling of the truly exceptional work of our university community. These honors and awards span across the breadth of disciplines that this institution represents, and I encourage all of you to take a moment to read through the list. It is really impressive. Congratulations to all the honorees. I also want to specially recognize another group, and that's the student representatives to the Board of Regents. These individuals fulfill an important role in bringing the student voice to the board's deliberations. We really appreciate their perspective and their thoughtful comments on the topics before the board. And this year, the following individuals served very diligently as student representatives. Austin Kraft, a Twin Cities campus undergraduate student, served as chair of the student representatives this past year. I'll also note that Austin is the recipient of a prestigious Fulbright Award. Brandon King served as vice chair and is a student at the Morris campus. Eliora DeMuth represented the Crookston campus. Spencer Bassarich, an undergraduate student, represented the Duluth campus. And this year we had 2 different students who represented the Rochester campus. Misk Misk Al-Zahidi and Elizabeth Patterson. Leah Batten from the Twin Cities campus represented professional students. Rodrigo Tojo Garcia served as an undergraduate student from the Twin Cities campus, and Anthony Kahane from the Twin Cities campus represented graduate students. So we really do thank all of the student representatives for their service, and we are grateful, very grateful to you. As we near the end of the spring semester, I also want to take a moment to congratulate all of our graduating students. Best wishes on your future pursuits, and I look forward to celebrating with you virtually on May 16th. I know this semester didn't play out in the way any of us could have imagined. On behalf of all my Regent colleagues, a heartfelt thank you to all faculty and staff across the university system for your tremendous effort to continue to deliver on our mission throughout these very, very challenging times. Your work is highly, highly recognized, valued, and appreciated. So turning to other items, yesterday we had a chance to review the President's recommended operating budget for fiscal year 2021, and I anticipate that we will take action on the budget at our June meeting. Regent McMillan announced this yesterday, but I want to remind the university community and the public that the board is interested in your feedback on this budget. Written comments on the budget can be submitted until June 2nd via a form on the Board of Regents website. And these comments will be published in the docket for our June meeting. All regents will have access to them, and they will be part of the official public record. The annual operating budget process is a reminder that our regular business goes on, even when we seem consumed with response to the COVID-19 pandemic. And our agenda today reflects that balance. We'll address some items related to the pandemic, but we'll also have our first opportunity to review the system-wide strategic plan, which was already well underway before the pandemic. I'll conclude my report with an announcement of the formation of the Presidential Performance Review Committee. This committee is established each year in May for the purpose of evaluating the performance of the president. This year, Regents Davenport, Swigum, and I will serve on that committee. I will act as chair of the committee and anticipate that we will deliver our report to you in July. We have a lot of important work ahead of us today, so I'll conclude my report here and we'll continue on with our agenda. Our next item is receive and file reports. I'll note that there are no receive and file reports this month. Moving on to the consent report, which is a review and action. In the interest of time, I won't go through the entire roster for discussion on this item. Rather, if you're interested in asking a question, making a comment, or asking for an item to be separated out, please use the raise hand feature or alert OBR staff. Mr. Langworthy, do we have anyone interested in commenting?
Mr. Chair.
Yes.
I'm sorry, this is Regent Rocha. Is on the consent report?
Yes.
Yeah, I would like to, the appointments to the East Gateway Committee, if we could pull that out, I would appreciate it. Thank you.
Sure. Okay. Let's see. So, so the East Gateway appointment will be separated from the consent report. Can I have a motion to approve the consent report without the East Gateway appointments?
So moved.
Is there a second? Second. All right. Any discussion for approving the consent report absent the East Gateway appointments? Okay, I see none. With no further discussion, Mr. Steves will call the roll.
On the consent report, absent the East Gateway appointments, Regent Anderson.
Yes.
Regent Anderson votes yes. Regent Beeson.
Yes.
Regent Beeson votes yes. Regent Davenport.
Yes.
Regent Davenport votes yes. Regent Herr.
Yes.
This doesn't print out the paper on the desk, does it?
I'm sorry, Regent Herr?
I vote yes.
Okay, Regent Herr votes yes. Regent Hsu.
Yes.
Regent Shu votes yes. Regent Kenyanya.
Yes.
Regent Kenyanya votes yes. Regent Mayron.
Yes.
Regent Mayron votes yes. Regent McMillan.
Yes.
Regent McMillan votes yes. Regent Rocha.
Yes.
Regent Rocha votes yes. Regent Simonson. Regent Simonson.
Yes.
Regent Simonson votes yes. Regent Swigum.
Yes.
Regent Swigum votes yes. Chair Powell.
Yes.
Chair Powell votes yes. Mr. Chair, there are 12 yes votes and 0 no votes.
Okay, so the motion to approve the consent report without the East Gateway appointments is approved. Can I ask for a motion to recommend approval of appointments to the East Gateway Committee?
So moved.
I hear a motion. Is there a second? I think I heard a second.
Second.
Let's now pause for discussion. Let's go first to Regent Rocha.
Thank you, Mr. Chair. I'll make this brief. I wanted to preserve for the record a couple things real quick. First, I appreciate the 3 individuals, their willingness to serve with exceptional credentials. I just want to make a couple comments. One is, it was not clear to me when the request for nominations came out, and I would just, I understand that it came through in a OGC memo back in February, and I didn't catch it, and I know other members also didn't catch that was a request, and of course that's by no means any sort of commentary on the candidates that are in front of us, but I'm hoping that we will have clarity, timeline and so on and so forth, because that didn't come out this time. But I want to make sure that as this board knows, I along with others have some concerns about ensuring the board has input in this process. I've got some broader questions about how this develops. It's a very, very important thing for the university. It is our eastern frontier, and I'll save the additional commentary for another time. And so I want to make sure that by supporting this, that it doesn't, that somehow doesn't give the impression that those reservations that I have and perhaps others may have are have been resolved, because those concerns still remain. And then finally, I want to just I want to make an appeal. I understand that the committee, as it's being formed right now, I think it's really important that if we are committed to diversity and making sure that diverse backgrounds and viewpoints are represented in things that the university does, that is the case in all that we do. And so I make the appeal to the foundation and to the board leadership as we go forward to seek to get a broader perspective in the makeup of this committee, because we're either committed to that or we're not. And as I understand it right now, that may not be present in the board or in that committee as currently constructed. So I want to make the appeal that we seek to do that. How the foundation is able to do that remains to be seen, considering the appointments that we are putting forward. Two, want to make sure that we know of how these things get, how these requests are made in the future, to ensure that all board members are aware that nominations are being made. And then finally, just that this does not eliminate those concerns that have been raised in the past. So with that, I greatly appreciate these very talented people and their willingness to serve the institution in this way. And I plan to vote yes on the nominations, but with those comments. Thank you, Mr. Chair.
Thank you, Regent Rocha. Regent Beeson.
I was not involved in forwarding those names, but I do have to say that I was impressed with their selection. These are really outstanding people. They're the best in the business. We have a lot of good people in real estate development in town. And I think they're going to add value beyond their fiduciary duties and the mechanical tasks that they've been asked to do. They're going to be good coaches and mentors, I think, to our staff and to the staff person that the new organization hires. I do understand the foundation's choices are be 3 diverse candidates. So I think among all the members of the special committee, this will be a balanced committee, gender and otherwise. Thank you, Mr. Chair.
Thank you, Regent Beeson. Regent Mayron.
Yes, I will be voting in favor of this proposal. Two of the individuals, Russ Nelson and Mo Sherman, I've had extensive dealings with in the past. They are outstanding candidates. I'm very pleased with the makeup of these individuals and the expertise that they will bring to this very important project. So thank you very much with respect to these nominations.
Thank you. Okay, and I'll just conclude by saying that via a resolution at our February meeting, the board delegated to me as your chair in consultation with the president to nominate individuals to serve as our representatives. We also solicited nominations and suggestions from the board following the February meeting, and three regents, including myself, did suggest individuals. Chair Swigum and I then interviewed the three individuals, and I just want to comment, tell the board that these are very impressive people. We emphasize the importance to the candidates of serving as the university's voice and East Gateway development, and it is clear, very clear to the vice chair and I that they will take that service very seriously. I do see one other speaker, Regent McMillan.
Thank you, Chair Powell, echoing comments from a couple of my colleagues. I don't know that it's well known, and it certainly isn't well enough articulated by us on a frequent basis, that we are the beneficiaries of tremendous volunteer expertise and experience in many ways. You see that at the Investment Advisory Committee, the Debt Management Advisory Committee, the Chancellors have advisory committees, most deans do. This is similar service, and the people that you've selected and that we're going to vote to approve today, we're just lucky to have that kind of talent willing to step up and support this university and the foundation in critical endeavors like this. So that we're blessed. Thank you.
Thank you, Regent McMillan. Regent Hsu.
Thank you, Mr. Chair. I was not involved in this process, and I did not support the creation of this special committee. I'll be voting against it, but not because of anybody who was ultimately selected for this. I don't know any of these people. I'm sure they're very well versed. I do hope that they do take seriously the views of the board as they do their work. And I do want to echo that there is a lack of diversity on this committee, at least from our side. I haven't seen the list of names from the other one, and I hope that we take that into consideration in the future. Thank you.
Thank you, Regent Hsu. Mr. Steves, I don't see any other names. Do you concur with that? Do we have anyone else here who'd like to speak?
Mr. Chair.
Okay. Well, thank you then. There being no further discussion, Mr. Steves will now call the roll.
All right. On the East Gateway Project Committee appointments, Regent Anderson.
Yes.
Regent Anderson votes yes. Regent Beeson. Regent Beeson.
Yes.
Regent Beeson votes yes. Regent Davenport.
Yes.
Regent Davenport votes yes. Regent Herr.
Yes.
Regent Herr votes yes. Regent Hsu.
No.
Regent Hsu votes no. Regent Kenyanya.
Yes.
Regent Kenyanya votes yes. Regent Mayron.
Yes.
Regent Mayron votes yes. Regent McMillan.
Yes.
Regent McMillan votes yes. Regent Rocha.
Yes.
Regent Rocha votes yes. Regent Simonson.
Yes.
Regent Simonson votes yes. Regent Swigum.
A very strong yes.
Regent Swigum votes yes. Chair Powell.
Yes.
Chair Powell votes yes. Mr. Chair, there are 11 in favor and 1 opposed.
All right. By a vote of 11-1, appointments to the East Gateway Committee are approved. Thank you. Let's move on now to the next item, which is the COVID-19 pandemic and the university's service to Minnesota during the pandemic response. President Gable will lead this presentation and subsequent discussion. President Gable, over to you.
Thank you, Chair Powell, Vice Chair Swigum, members of the board. There are several updates that have emerged during the course of our response to the pandemic that you've heard before, but we thought it would be helpful both for your understanding and for our university community at large to have a chance to hear everything synthesized during one report, so that the experts and leaders involved who've brought these responses forward could answer questions, or so that we could just see the scope, scale, and facets of the way in which we've been responding. It has been a very challenging time. That can't be stated often or deeply enough, but we're very proud of what hasn't changed or been challenged during this time, which is our commitment to service to the state of Minnesota and to society as a whole, to our mission, to our culture, to our people, faculty, staff, and students in the community at large, and our willingness to adjust and pivot as information and circumstances have allowed or dictated. I want to acknowledge each and every member of our university community and tell you how I see how magnificently you've responded. Our faculty transitioned to instructional formats in a matter of days, hibernated most of their research, and as you will hear about in a few moments, many of our scholars and experts across our system have jumped feet first, sometimes head first, into COVID-19 research with groundbreaking exploration, new clinical trials, and even homemade ventilators to serve critically ill patients. Staff have stepped up, from law enforcement and emergency responders who keep us safe, to behind the scenes workers, particularly those in information technology and essential services who are supporting our massive move to remote learning and working. Our students have demonstrated unbelievable flexibility and understanding, yet commitment to the task, including regularly meeting in their governance, advocating for what they need, and working with us as partners as we've navigated through this last semester. So together as a university family, we've merged our talents and resourcefulness in ways that we think have been in service and have had a positive impact. In this spirit, the university relations team has been aggregating our system-wide efforts in education, innovation, and discovery as we contribute to solving the challenges presented by COVID-19. Through a microsite on the U of M homepage, you can see the stories, insights, and expertise that are at the forefront of our service mission. I found it very uplifting to see the things we're doing as a community, and I hope it has the same impact for you. For example, there you will see the great work of CIDRAP and how they're tracking and analyzing the rapidly evolving pandemic, including their most recent April 30 report, which serves as a leading resource for the university, public health experts, business preparedness leaders, government officials, and the public. You'll see the incredible work of the Health Emergency Response Office, or HERO, and how their work ensures that health incidents and emergencies affecting the university community are addressed in a timely, efficient, and effective manner. You'll see how the School of Public Health is assisting the Minnesota Department of Health with the COVID-19 modeling that is playing an influential role in state decision-making. You'll see our partnership with mHealth Fairview, which has led to the opening of the first regional COVID-19 facility at Bethesda Hospital in St. Paul. You'll see how our university departments and centers, including several of our colleges, have designed PPE and consolidated their existing PPE and redirected it for healthcare use. You'll see how the university has deployed its Medical Reserve Corps, the largest in the state and one of the largest in the nation, to strengthen public health, improve emergency response capabilities, and build community resiliency. You'll see our researchers' innovation in the development of our own polymerase chain reaction testing solution to aid in the diagnosis of COVID-19, as well as the creative work to develop an N95 mask alternative and ways to prolong its use. You'll see the latest scientific information and analysis from our globally recognized experts on all elements of this worldwide public health challenge, everything from examining the virus itself and the disease it causes, to societal effects, to mindfulness, and other practical tips for managing quarantine situations like safe grocery shopping, policy implications, and much more. And you'll see the impact of our partnerships, like with 3M and their $2 million gift to support infectious disease, and the Hormel Foundation and their recent $1.5 million grant to support the CFANS-led Farm Initiative, as well as the work of the University of Minnesota Foundation, which arranged 2 special funds to help students and healthcare workers. With regard to transformative testing, you'll see how late last month, the university was asked by Governor Walz and the legislature to begin testing up to 20,000 Minnesotans a day for the presence of COVID-19. We're thrilled to do our part using science and research solutions developed at the U of M just over the last few weeks to help protect the health of our communities and accelerate our economic recovery. And you'll see how our medical school is identifying ways to attack COVID-19 vulnerabilities, as well as establish a volunteer organization to assist essential workers, particularly frontline healthcare workers and first responders, with childcare, errands, and other tasks while they work to save our lives. And how a Department of Pediatric resident wrote a COVID-19 children's book to help children process the emotions they're feeling while staying at home. You will see the FDA-approved COVENTER Ventilator developed by experts in our medical school and College of Science and Engineering, which serves as a practical and scalable version of a ventilator being produced in collaboration with private Minnesota business partners while serving as a first of its kind to reach the front lines of healthcare around the country. You'll see the work of Extension to help rural Minnesotans through a 14-day emergency meal kit and guidance on what to include in the kit, including food like pancake mix, peanut butter, soup, and crackers, which I've been living on for the last 2 months. You will see the work of many of our researchers, staff, and students through the UCAN network, which is the University COVID Action Network, and how, while not engaged in medical work, they've leveraged their capacity and their intellectual rigor to support our frontline medical staff with research, analysis, and idea generation. You'll see how the U.S. Army system as a model, University of Minnesota psychiatrists, psychologists, and anesthesiologists, along with administrators, relied on this model, springing into action and in just 1 week, developing and deploying the novel Minnesota Resilience Action Plan, or MNRAP, for protecting the emotional well-being of mHealth Fairview's healthcare workers in the COVID-19 climate. And you will see that the University of Minnesota is one of a select few universities worldwide conducting high-level clinical drug trials related to COVID-19. Already, the university developed a variety of drug trials focused on solutions for delaying, preventing, and treating the COVID-19 virus and therapies for mitigating the effects of COVID-19 symptoms during and after the infection. From a drug called hydroxychloroquine, which aims to prevent people who've been exposed to the virus from getting sick or to reduce the severity of their illness, to the drug losartan, used to treat high blood pressure, which aims to prevent the new coronavirus from progressing once a patient contracts the virus, to the experimental drug remdesivir, originally made to treat Ebola, which aims to help patients in severe stages of the COVID-19 disease. Members of the board, the spirit of all of this work can be found in something we talk about a lot, UMN Proud, and the countless actions of service across our system over recent weeks, which instill gratitude in all of us. I've enjoyed seeing the unique ways our university family is making the best of this challenging time, from your pictures and videos through the hashtag UMNProud social media tag, to reliving our athletic successes on the field and on the ice, to how the university's innovation and creativity are helping those who need it most. Like you, I've reveled in successes like Nabir Sarma winning the Collegiate Jeopardy Championship, or Scott Perunovich from Duluth winning the Hobie Baker Award, our Gopher football players being drafted in the NFL draft, as well as the opportunity to extend thanks to our many frontline heroes and all of our staff on all 5 of our campuses and beyond who are facilitating our good work and making sure our services, our impact, continue for those who need them in what can often be truly exhausting circumstances. So whether you are in Crookston, Duluth, Morris, Rochester, the Twin Cities, at any of our extension stations, research locations, anywhere in Minnesota, you have our appreciation and gratitude, and we encourage you to continue to share the ways in which you are UMN proud. These examples not only help us stay healthy, safe, and well, but they give us hope. So that concludes my presentation, Mr. Chair. I'll take any questions you may have.
Okay. Thank you, President Gable, for that report. It's very inspiring. It's very inspiring to see, how the entire university team, embraces our value of service, in so many ways. And so thank you for that report. And I'm sure there's much more. I think we'll just go through in alphabetical order here for comments, thoughts, reactions, suggestions, and we'll start with Regent Anderson.
Thank you, Chair Powell. I don't have really anything to add, but I will just say that I appreciate the university has been sending out daily updates on press releases and articles about all the things that have been happening. So I appreciate knowing about all those things, because it is amazing when you look at the work the University of Minnesota and all of our faculty and staff are doing to help America through the COVID-19 pandemic. I think it's terrific. But again, I'm aware of everything. I don't have anything to add here for the general public, but appreciate the work of all those doing their work. Thank you.
Thank you, Regent Anderson. Thank you. Regent Beeson?
Thank you, Mr. Chair. This certainly is inspiring. We're always proud of the work that our students and staff and faculty and leaders do for us, but this is really, beyond words. The founders of the Morrill Land Grant in 1862, when they gave that designation to the University of Minnesota during the Civil War, would be proud. This is really land grant work, research work, transmitting knowledge to the people, outreach, research. It's a great moment and a very difficult time.
Thank you. Thank you for those words, Regent Beeson. Regent Davenport.
Thank you, Chair Powell. There is really so much that we could say. I'll just summarize it by saying to the whole of the university community, thank you.
Thank you. Yeah, and thank you, Regent Davenport. Regent Herr.
Thank you, Mr. Chair, and to President Gable and the administration staff, students, the community. Just so much appreciation for the work, the care that you give, and the passion that you're bringing to this issue, and really taking ownership of our responsibility and our mission. And so just nothing but praise and appreciation. Thank you, Mr. Chair.
Thank you, Regent Herr. Regent Hsu.
Thank you, Mr. Chair. I too would like to thank everybody for their efforts and their creativity in this. I think it's going to be a longer haul than some of you, but I hope everybody paces themselves and continues to stay well. Thank you.
Thank you, Regent Hsu. Regent Kenyana.
Thank you, Mr. Chair, Madam President. Again, just want to echo the same kind of comments that my colleagues have said. Every day we're seeing examples in the media of how our university community members are rising up to the challenge. And I definitely think character is best determined in crisis. And from every level, students, staff, faculty, and university leadership, I think our characters is being revealed. So a big thank you to the university community and to you and your team for the leadership.
Thank you, Regent Kenyana. Regent Mayron.
It's tough to add anything from what my former colleagues have already said. So I will just say that I echo every one of their sentiments and shout out a big thank you to the entire university community for their efforts and commitment and devotion to try and address this pandemic. So thank you.
Thank you. Thank you, Regent Mayron. Regent McMillan.
Thank you, Chair Powell and President Gable. One recognition and then one question, and I don't know if this is for the president or for Dean Tolar, but the recognition is I've had the opportunity to witness and participate as a watcher and a learner in several webinars, both through the School of Public Health, the School of Medicine, that really do an outstanding job of bringing forward the latest thinking. Usually a lot of it over my head, but the commendation I want to do is that the foundation seems to be doing an outstanding job bringing our diversity in the public and the medical health spaces, and I'm just really impressed in the work that Kathy Schmidlkoffer and Patty Porter, that whole team, are doing in that space to tap the donor market. So the thank yous to them for recognizing the opportunity, seizing it, and then to the donors who actually step up and deliver in times like this. So that's great. Here's the question. I get confused watching the news at night about where we stand in our critical element of the testing piece here. And I know 20,000 is a goal that's shared with Mayo. And I don't know if there's a way to put any more crispness around how close we are to getting to our piece of that goal. And if not, I'm okay. I can maybe get some offline education, but it feels like that was announced, and I know we're making progress, but I'm curious, is there a metric we follow as to how close we are to actually meeting the governor's moonshot goal and our specific commitment and partnership with Mayo?
Thank you, Regent McMillan, for your comments and for that question. President Gable, I'll turn it over to you. I suspect you may turn it over to someone else, but if we can get some response to Regent McMillan's question.
Yes, your suspicion is accurate, Chair Powell. I would like to turn to Dr. Jacob Tolar to answer that question.
Thank you, Madam President, Chair Powell, Regents, Regent McMillan for the question. We are absolutely on task. So the discussion we had with the governor, with the commissioners, has been circling around how can we manage the pandemic. And the only way to do this is not just to do testing, but rather to do it at scale that will provide the understanding and the information that can guide some of the decisions, such as the presidential sunrise or other movements that you as a board will recommend in your wisdom and predictive skill. The reason we gotten to this position, before I get to the numbers, if I can, is that we have been able to reach to within the research potential of this medical school and this university in ways that you have framed it so well at the beginning of this session and over the duration of your tenures. The reason we were able to be competitive and asked to co-lead this coalition was that we were the first to understand how the virus actually interacts with the cell. This is the structure that has been published early March after about a week of rapid collaboration between the veterinary medicine and medical school teams. From that standed up the antibody testing, the serology testing, and that has become a leading qualitative test for the serology, which is the antibody response to the virus. At the same time, when we realized at the beginning of March or end of February rather, that there's going to be a tremendous competition over the reagents that go to the polymerase chain reaction, that's the molecular testing that the president mentioned, we have built our own. Within 5 days, we were ready to go. And then we scaled it up. This is the most seamless way of getting from the research to the technology, to the service to the society as a true land-grant university. Now, we have had the discussions with the Commissioner Malcolm France, with the Governor Walz, and split it in 2 phases. Phase 1 takes 4 weeks and will get us to 20,000 molecular tests, that's the PCR test, and 15,000 of the serology tests at the end of that phase. That's about 3 weeks away from now. The trajectory is perfect. We are actually ahead of the plan in everything that we do, and it dovetails beautifully with what James Hereford and I put together as what we call a restore program. It's a sort of a clinical version of the sunrise that the president has mentioned and Vice President Kramer have put together, and that is to get to the 4,000 people, many of them with cancer, that have been waiting for a month and a half to actually have their surgeries done, and we keep them on chemotherapy and radiation. So this is not just an epidemiological exercise. This is a absolutely acute daily suffering that we are aimed to alleviate. So the simple question, a simple answer to your question is that we are well on track. And with the leadership of my Vice Dean for Research, Shaker, and collaboration with Gianrico Ferrugia from Mayo, and of course the MDH, we are here to make you proud and under promise and over deliver. Back to you, Chair Powell.
Oh, thank you very, very much, Dr. Tolar. Regent McMillan, any follow-up?
No, thank you, Dean Tolar.
Okay. All right. Okay. Thank you, Regent McMillan and Dean Tolar. Thank you so very much to you and your team and the wider research group for your fantastic service in this way. All right, let's move now to Regent McMillan.
I don't get another bite, do I?
Oh yeah, right. It's no, you're done. Yeah, that's a mistake. Sorry. Let's move to Regent Rocha.
Thank you, Mr. Chair. I yield my time to Regent McMillan. I would just simply echo Regent Mayron's echoing of the previous comments. The university is really demonstrating why it's valuable to the state. Thank you.
Thank you, Regent Rocha. Regent Simonson.
Yeah, I too, can you hear me?
Yes, we can hear you, I think.
Okay, yeah, I too appreciate all that's been done and that we're continuing to do. And yes, it's a great example of land grant mission, but I see us as global leaders. With the technology we have, the PCR, the ELISAs to vaccine targets. So I think we're a global leader in this. And Dr. Toller, I also want to thank you for working close with the Veterinary College. I had some comments yesterday from some senior students about hands-on work, and I know you're doing what you can do to help open up some areas like the Equine Center, so I appreciate that. I hope we can be opening up some more areas soon so that these senior students can get the full education that they need, although I know they won't graduate without full accreditation, I know that. One quick question, I guess, for Dr. Toller. Are we charging for the PCR and ELISA test by test?
Dr. Toller, did you hear the
Paul,
question? Yes.
Simonson, yes. So first, a comment about veterinary medicine. This is an incredible college in this university. They were, as I mentioned, not only on the forefront of understanding the binding of the spike protein of the virus to the epithelial cells of the lung. They also have been on a forefront with Dean Mulgard on the veterinary diagnostics lab testing, so the capacity that has been harnessed in the veterinary diagnostics lab will be incredible aid in what we are doing. The cost of the testing vary. So we are very clear that we will not engage in any price gouging of any sort, in this. So we are essentially looking for the billing system that would make it harnessed within the healthcare system that we serve. And as you, of course, all know, we serve many underserved populations. So this has all been taken into consideration. This is very clearly and intentionally nonprofit maneuver.
Very good. Thank you, Dean Toller. Regent Simonson, follow up or other comments?
No, thank you very much for all that you're doing.
Thank you, Regent Simonson. Regent Swigum.
Yes, great job, of course, by our university folks. My thought is that kind of taking the advice or the direction from Regent Rocha, that we should not be afraid to tell our partners and our friends in the legislature about the great and the leading things that the university community is doing. I just think we need to share with them, make sure they're well aware of their investment and how it's paying off.
Thank you, Regent Swigum, for that comment and that good suggestion. I'll just conclude by yes, echoing a bit, but we are here to serve, and we are serving at the very, very highest level in this crisis. And as you've already heard, I'm sure that the founders of our university would be very, very proud at this moment. So I don't think that anyone else wants to speak. Everyone's had an opportunity to speak. So unless I see others, and I don't, I will thank. Yes.
Regent Kenyanya is wishing to speak.
Okay, thank you, Mr. Steves. Regent Kenyana.
Thank you, Mr. Chair. Thank you, Mr. Steves. I have a brief question. Well, before that, I should comment when Dr. Tolar was called on, and I was thinking in my mind, regardless what the answer is, it's going to sound like good news. I just can't imagine bad news coming from Dr. Tolar. But my question, and I don't know if this is the appropriate discussion, but we talked a lot about what we've been doing outside and for the community and fulfilling that outreach and land grant mission. But I was curious if I know we don't have a lot of students on our campuses. Obviously, most of them have returned to their homes, and for others, the campus is their home. Do we know of any? Do we have any data on the prevalence of the disease within our campus in terms of maybe the few students who are left in the dorms, and if there's any data on that, if there's hotspots in certain places, or if we just don't have that data?
Thank you for the question, Regent Kenyana. President Gable, I think I'll turn to you first, and you see if you want to redirect.
Thank you, Mr. President. Regent Kenyana, I'm going to defer to Dr. Tolar, although what I will say in advance of his response, and I suspect he will concur, is that we have public health experts who serve specifically our university community who are tracking that data, and we could certainly pull it for you. We have not had a hotspot, just to be clear, in advance, but we have been affected. And with that, I'll turn it over to Dr. Tolar.
Chair Powell, Madam President, I cannot improve on the articulate response the President has made. No hotspots, testing underway. We are absolutely, on target, and will serve Regent Kenyana, the student body, as best as we can.
Okay, thank you, Dr. Tolar, and thank you for your question, Regent Kenyana. I'm going to turn now to Regent Hsu.
Thank you, Mr. Chair. Thank you, Dr. Tolar. I guess the question around testing that I have is, of those tests that we're making available for the state, how many of those, or what is our testing capacity for ourselves, and including our student body and faculty and staff, and in the likely, push to reopen the campus? I think we need to understand what our capabilities are for ourselves.
Dean Tolar, I think that question is for you.
Chair Powell, Regent Hsu, very, very good question. And let me make several comments about the testing first. As many of you know, I came across the Atlantic from Cambridge to study molecular biology here. And I am an immunologist by training, by virtue of my day job as a bone marrow transplant physician. This is relevant because today it seems that everybody is an immunologist and everybody is an epidemiologist. And there are a lot of gray zones around, the knowledge that we can provide. So there is, first of all, not a linear, movement from this is how many tests you have, and this is, how many people you can release, on campus or in any other setting. In fact, our I think conceptual contribution to the whole testing discussion with the CEOs in town and in the state, and with the commissioners and the governor, has been that we are in support of a dual testing. In other words, you need to have the polymerase chain reaction that tells you that the virus is there, that you are shedding it, at the same time that you are going to assess how the body has responded to that viral load and in what way, and that's the antibody, that's serology testing. Having said that, the buildup at the moment is such that we will serve the patients that we serve in our system first, and the students and the staff that we have at the university first, before we would deploy in a multitudinous ways across to the state. At the same time, however, we have already engaged with the tribal nations. We have already engaged with congregate living facilities across the state to really help in a very proactive, very intentional, and very land-grant university-like way in the hotspots that are definitely existing through the state. Back to you.
Thank you, Dean Tolar. Regent Hsu, does that address the question?
Thank you, Mr. Chair. Thank you, Dr. Tolar. I guess I didn't quite hear how our students would be able to get tested. My understanding is Boynton did not allow students to get tested earlier in this process, and I'm wondering, also who's going to be paying for these tests and what they cost.
Dean Tolar.
Chair Powell, Regent Hsu, very practical, very pragmatic, and very relevant question. First of all, we are open to anyone on at the campus and at the university that is symptomatic. This is really important. We are not at the stage, because of the trajectory that I described, to test every single individual that wishes to be tested. We are focusing on people, as I mentioned, that have cancers that need to be operated on, so that we can provide these, what I would consider essential services to the patients and the Minnesotans that are looking at us. Anyone who is symptomatic, however, student, staff, physician, doesn't matter, can be tested today. We have 5 different testing capabilities, stations in town, 2 lanes each. This is more than 1,000 tests every day. This is absolutely something that can be used right away. The billing is at the moment, going back to the previous question, the billing is a part of healthcare. The advantage of having healthcare, system as we do in this state and in this union is that this is considered, and with some enlightened acceleration of the regulatory process, has been included in the portfolio of what the insurances premiums pay.
All right, thank you, Dean Toller. I'm going to move on now to Regent Simonson.
Just a quick question for Dr. Toller. I asked Dr. Kramer this yesterday about the PCR test, and as I understand, we have at least 3 mutations of the COVID-19. Have we tested the PCR against these mutations?
Thank you, Regent Simonson. Dean Toller.
Chair Powell, Regent Simonson, I'm very impressed. You are so good. So yes, we have been able in the United States to sequence hundreds and hundreds of different isolates of the COVID-19. What we have learned is that the initial one, it's called G614, that came out of China, has really not been as widely spread in the United States and Canada as its clone, if you will, or a descender, if you will, G614. What we are learning now is that it is quite possible that the G version of this is more transmissible and perhaps leads to a higher viral load. So we are very good at actually sequencing these viral isolates, and it is Vice Presidents Kramer, Chris Kramer, Schaub, and Kenny Beckman, who leads our molecular lab, that have been phenomenal leaders, in this. But if you let me, I fully expect that one of the variables that people do not consider, this board does, but people don't in general, is that the virus will change. That is how viruses behave. That is why we have a different flu vaccine every year, because that virus changes too. And it would be very unlikely that we would see this not changing. And again, it is the research depth. This is under the waterline research that you are supporting, not just in medical school, in university in general, that will allow quick adaptation to this and will allow to stay on the forefront of this, because that's what we are here to do.
Thank you.
Thank you, Dean Toller. Thank you. Thank you, Mr. Steve. So there are no other speakers. I want to thank President Gable and Dean Toller for this discussion, and the board for all your good questions, and thank you. We'll move on now to our next agenda item, which is the system-wide strategic plan. This will be a review discussion today. I'd like to make just a few comments before turning over this discussion to the president. And I first and foremost want to thank President Gable for meeting the timeline and the timetable for review of this important plan. Despite the extraordinarily challenging circumstances that we are in, we remain on track. So Regents, as you've reviewed the docket materials, I'm sure you've noted that the plan you're seeing today and have read and looked through is a more detailed and refined version of what we discussed with President Gable at our retreat. The important difference since that conversation is that the plan that we're going to discuss today has been fully consulted with faculty, students, and staff through the university's shared governance structure. And so it comes before us today with its strategies and its initiatives having been reviewed and carrying the support of the university community and the leaders who will implement it. As we have our formal review of the plan today, our objective is to have a thorough discussion with President Gabel to provide our perspectives and our feedback, suggest additions or deletions, or give other thoughts and suggestions. And our goal is to have the final plan in front of us for action in June, and then spend this summer digging in on how best to bring the plan and all of its actions to life across the university system. So before I turn it over to President Gabel for her presentation, I just want to share my sense of excitement about the plan. I find it to be very thoughtful, it's very comprehensive, it's very substantive. The plan builds on the 5 core commitments that we've reviewed several times over the course of this year, and it includes 16 priority goals. And within each goal, there are 3 or 4 very concrete action items proposed to achieve the goals. And these action items include, just as a few examples, commitments to innovative distributed learning to increase student access to our programs and offerings, a commitment to strengthen the career readiness and placement of our students, a commitment to continually increase year-over-year research activity, commitments to increase the level of new business startups, and develop and deploy new techniques to help our agricultural industry, commitments to reduce student debts, and many, many, many more. So I look forward to our discussion this morning. President Gabel, the floor is yours.
Thank you, Chair Powell, Vice Chair Swigum, members of the board. I bring for your review today the University of Minnesota's proposed system-wide strategic plan. I recognize that it's a challenging time to have this conversation, and this would be easier done in person. But I want to assure you that since we were together at the retreat in March, the work has continued. As the chair described, we've been across the system, across our constituency groups, both within our immediate university community and beyond, engaged in active shared governance. And what you see before you is a reflection of that ongoing work. This work is really important now more than ever also because it provides guardrails on our collective decision-making and ultimately will help us emerge stronger as we look to the future. So just as a reminder, phase 1 of the system-wide strategic plan began during the fall of 2016 and was led by co-chairs Vice Provost Rebecca Ropers and then Chancellor Stephen Lemkuhl, who ultimately developed the system-wide strategic framework, which you adopted in June of 2017. Phase 2 of the system-wide strategic planning process occurred during the 2017-18 fiscal year and determined system priorities and focus areas aligning with the university's mission and the system-wide strategic framework that you approved the year before. At the September 2018 Board of Regents meeting, within the context of the presidential transition, a 1-year system-wide strategic priorities for 2018-19 was discussed and included some key elements of the 5 areas established the year before. Members of the board, phase 3, the final phase of our system-wide strategic planning process, then began with our engaged conversation in Faribault last July, which probably seems like a lot longer ago than just last July. At our subsequent meetings in September and October, I highlighted the timeline and consultation plans towards your review and discussion of the full plan at today's meeting, with action in June or July and a review then and refresh of the maroon and gold measures likely at the retreat also in July. In December, I formally presented the university system commitments, which guide our strategic planning efforts. And in February, I presented system goals, which represent how we intend to fulfill our system commitments. As a reminder, the commitments sit at 100,000 feet, the goals would sit at 30,000 feet. And then at our board meeting and retreat in March in Cloquet, I presented a draft framework of action items, which represent how we intend to fulfill the draft goals, which are designed to be measured year over year and also over long horizons for improvement or by hitting a set target. More specifically, under the action items, once we approve the plan, we would then establish a set of measures or a dashboard, which would represent a refresh of our maroon and gold measures. Members of the board, the draft plan presented to you today is a result of broad and ongoing consultation with faculty, staff, and students, alumni supporters, partners, and the legislature, members, friends around the state. Over the last 10 months during phase 3 of this plan, we've held town hall meetings in Crookston, Duluth, Morrison, Rochester, and last month hosted a virtual town hall across these campuses to seek further input. We've discussed the plan at the annual extension conference in Duluth, at homecoming on the Twin Cities campus with the alumni leaders who were there, at the FCC, Twin Cities deans with internal audit and senior leadership team retreats, at the Minnesota Water Resources Conference with the UMF board and executive board, with the University Senate, Student Senate, and across all of our formal and informal faculty, staff, and student committees, including the Black Faculty and Staff Association, the U of M Retirees Association, and among representatives from labor represented, civil service, and P&A employees. We've also consulted among numerous colleges and departments, from the CEHD Fall Assembly to the Dean's Advisory Committee at the Humphrey School to the CLA Assembly and CSC's State of the College. I sent out system-wide email messages on September 17th, October 9th, February 14th, and April 17th, linking to the initiatives page on my presidential homepage for input at every critical stage of this process. Similar messages were sent out to our alumni community and to our state's government and elected officials, including all 201 legislators, the governor and lieutenant governor, our congressional delegation, mayors and city council members in Crookston, Duluth, Falcon Heights, Minneapolis, Morris, Rochester, and St. Paul, amongst others. In addition, I've sought input specifically from Senate Higher Ed Chair Paul Anderson and Ranking Member Greg Clausen, as well as House Higher Ed Chair Connie Bernardi and Ranking Member Bud Nornis. We've also sought feedback amongst our business community partners, from the membership of the Minnesota Business Partnership to the Twin Cities Dunkers and the Capital Club. And we've engaged with our tribal community partners during the 6th annual Nibi Manawa Manuman Symposium at White Earth Nation and during the Native Nations flag event at the Humphrey School, amongst other important meetings and one-on-one conversations. I've also engaged Minnesota's public and private higher ed institutions with partnership meetings with Minnesota State and the Private Colleges Council. And in particular, we've sought the expertise on strategic planning from our strategic planning experts within our faculty, because we always consult our own faculty experts, including, with great appreciation, Humphrey School Professor John Bryson, our recognized national expert in strategic planning. Members of the board, this time I want to walk you through this. I'll start with what it is and what it isn't. The plan is specific and measurable. It has clear goals and action items, and it is a guidepost for the kind of institution we want to be. It also needs to be adaptable because our circumstances will change. We've never seen that more clearly than we do right now. But it is not a detailed playbook that provides an answer to every potential decision. It is not a crystal ball. It is not a regulatory guideline. Instead, it's a set of commitments that we commit to on behalf of all the constituencies that we serve, and then a plan for how we would act upon those commitments. So starting with commitment 1, where everything starts at a university like ours, we commit to student success. And student success circulates and orbits around attracting, educating, and graduating representative students. Within commitment 1 are goals. And the first goal is to then commit through the action items that you see represented on this slide. The first action item is to establish a system-wide strategic enrollment plan. We've already been working on this, as you know, and we've been reporting on this already. I want to mention, as we talk through some of these action items, that as I've said to you all along during the course of phase 3 of the system strategic planning process, that the work of the university doesn't stop while we're doing system strategic planning, that as you all have blessed various phases of the plan, we've been acting on what we anticipated would happen so that we enter the final approval of the strategic plan with much of the work already underway so that we can hit the ground running. And our system-wide strategic enrollment strategy would be an example of that. The university system must be continuously articulated and invested in. And our system-wide strategic enrollment planning process is the cornerstone of that aspect of our obligation. The next 2 action items are to improve retention and graduation rates of all students and to expand scholarship opportunities. I want to point out something else here, which is that these second 2 action items overlap with commitments around fiscal stewardship and commitments under community and belonging. You will hear some overlap, repetition, from one commitment to the other, and that is by design. These are not silos, each of the commitments. They are a network, a set of gears where the teeth connect to each other that spin together in order to move the entire university system forward. So while we describe them in 5 vertical columns, they really need to be thought of as an overlapping, rubriced organizational plan that will move the entire system forward. Goal 2 is about the student experience, their wellness, and their success. The first action item refers to the mental health initiative that we've been talking about since the summer of last year. As I mentioned earlier, there were plans to hold a big summit with Minnesota State and the private schools in May, but we've postponed that. Although the work on behalf of our students and the activities around knowledge sharing are paused, but we're still providing services, reviewing our own environmental scan, and our faculty and staff commitment to student mental health and student advocacy in this space continue. There continues to be activity around career readiness and placement for all students, which is our second action item, and then implementing a holistic approach to our student wellness, which is in our 3rd item. Goal 3 is around alternate delivery and modalities of course content. When we had our town halls and meetings that took place after the retreat, I talked to all of our community partners about how strategic plans aren't crystal balls, but they should have some capacity to help the university look around corners. And little did we know that the work that we envisioned under this goal and the related action items would be so important to us, as we had to pivot so quickly to online offerings in the spring, and then more planfully and with a little more runway time for the summer and potentially in the fall. When I discussed this with you in March, there was slightly different language in this goal. At that time, the thought was that the way everyone teaches online is sort of already presumed because faculty already use Canvas or Blackboard or have their own websites. And we've pivoted based on the feedback that we've received since we were in Cloquet to think about a purposeful expansion of alternate modalities that includes things like the pandemic, but the pandemic as more of an attribute than an underlying strategic basis for doing what we do. Instead, these action items are designed to develop distributed, scaled learning that allows flexibility and deepens the support that academic technologists and instructional designers, and I know I've thanked them many times, but every single time I have to thank them again, are providing to students so that we can meet students where they are and teach them in ways that make sense for all of the different ways that students learn and all the different content that students seek. Next slide, please. Moving on to commitment 2, we look to the other leg of our stool as a research university system: discovery, impact, and innovation. Goal 1 is around research. The university wants the research experience to be available to students at all levels, which is reflected in the first action item. The next action item is around funding, which of course we've talked about at length since our retreat in Faribault. And the last is to ensure that our graduate students and postdocs receive the support they need to have successful careers, be well themselves, and be satisfied with their career outcomes. This was an action item from the start, although it's articulated more clearly as a result of feedback received from our graduate students in COGS, PSG, and the faculty and staff who work with them. Goal 2 is around creativity and collaboration regarding the entrepreneurial spirit. The action items here refer to thinking about innovation as part of discovery and discovery as part of innovation, depending on the nature of the work and what it means as a community to be a part of an entrepreneurial ecosystem. And then how do we think in a multidisciplinary way? How do we purposefully maintain the importance and impact of the arts and their humanities in their own right and also through strategic collaborations? Goal 3 is around the university's impact as a public land-grant institution of higher learning. We've talked about this at virtually every board meeting. What constitutes impact is the subject of ongoing discussion. But the first action item is to enhance the university's Carnegie Community Engagement designation across the system and to measure and expand outreach and engagement. This designation provides an architecture for how to measure community engagement, but engagement also refers to how the university is viewed from the inside and from the outside looking in. So the next action item is to elevate the university's national and international profile and standing as a way in which to create a platform for how we address societal needs. So this looks at things like rankings and how the university's work is cited, what the impact of the work is amongst our peers, and what our general awareness is amongst peers and peer institutions. And then the third action item is how the state invests in the university's work, which is most logically captured by the MnDRIVE partnership. Commitment 3 is intersections, and I still smile every time I say that. I also still look around the room for eye rolls, but since there's no room for me to look around, I'm going to presume that I've said it often enough that you all are used to this terminology now. But this refers to our distinction as a University of Minnesota and the desire to amplify Minnesotan attributes of excellence in order to create a competitive distinction and frankly capitalize on the storytelling around who we are as the University of Minnesota, but at world-class levels. So this commitment looks at the intersection of challenges and opportunities that are deeply robust in this state, that the university as a system has world-class excellence in its capacity to address. At the current moment, the focus is on health, sustainability, and food and agriculture. But this commitment is also intended to be a space for agility and nimbleness as different questions emerge. So there could be a totally different set of goals under intersections by the time this chapter of strategic planning ends and a new one begins. So starting with our first goal around health, the first action item is to be a model in how the university system trains clinicians and offers care. The second is to deepen the university's impact in core areas of strength. So you see us doing this in the COVID-19 pandemic. And this goal is exemplified in the work of our clinicians and health scientists and how we engage in research to find solutions and cures. The university has about 30 fast-track drug trials underway right now, with several more likely to come on board, particularly with the partnership with Mayo and the testing that the governor announced recently. And this is all representative, as I described earlier, of the way in which much of the work that we have in this strategic plan was already happening, that the university work continued during the course of the strategic planning process. And then last but not least, the third action item is to be forward-thinking about how we deliver care and the questions that society as a whole is asking and posing around healthcare delivery models and the challenges associated there. Goal 2 is around sustainability, a critical attribute in the state, both in terms of environmentalism and natural resources. It's a deep strength across the university system. The first action is to be a state and worldwide leader in our teaching and research that we do across the spectrum of subjects that could be described under a sustainability umbrella, and how we as a research institution can convene to have the conversations, discussion, and analysis associated with answering questions and furthering our understanding of sustainability. Second action is to establish system leadership and governance for coordinating sustainability initiatives. This refers to the way in which we are a really well-regarded and have the potential to be even more impactful voice around policy and the policy specifically associated with sustainability initiatives, locally, nationally, and internationally. And the third action item is to hold ourselves accountable around the work we do as a system to have our own climate action plan and make sure that we are responsive as a partner and as an entity to solve the climate emergency challenge. There's a lot of student advocacy around all of this plan, but particularly around action item 3, which we appreciate. And as you all know, we're working on the details and want to have this in the strategic plan so that there can be measures and accountability going forward. Goal 3 is around food and agriculture, and the items and action items are around smart farming, food and supplies, and our commitment to natural resources. Expanding the talent pipeline, both as a commitment to student learning and research, and also as a commitment to our rural communities. Enhancing the reach of extension, which is a core attribute of who we are as a land-grant institution. And pulling all of this together because this is who we are as the University of Minnesota and always have been. I want to be clear because there's a lot of historical context to Goal 3 and really to many of the things we're talking about here. That strategic plans are not meant to rip existing initiatives in half. There's an adage in strategic planning that around 85% of a strategic plan is to reflect and enhance things that were already going well, and the remaining 15% would be new things that come up as a result of the strategic planning process and the creative input that the strategic planning process allows you to leverage. And I think talking about our impact in agriculture and food is a classic example of that. We have always been about serving agricultural communities. It's part of the land grant mission. It's a cornerstone of our state. but we're also strategic and forward thinking about what that means. So moving on to commitment 4. The first goal is around recruitment and retention of a representative student body, faculty and staff, and then the work that goes into ensuring that the disparities of underrepresented groups diminish, with the goal ultimately being down to having no disparities. The second goal is to be a welcoming and inclusive campus. These are really two sides of the same coin. The action items are to measure and address the annual climate survey data, but also to address job satisfaction, and then together to develop education and training to increase our intercultural competency, interactional diversity, and overall sense of happiness with being a part of our community. The third goal is to advance understanding and nurture enduring partnerships. The first action refers to our institutional history, which is the broad umbrella under which the charge of the board from last spring will fall, including renaming and all of the efforts that came about as a result of the Campus Divided exhibit in 2017 and the work that preceded that. Board's made a commitment to work in this area, so we've amplified that in the strategic plan. The second action item refers to our partnerships with Minnesota's tribal nations, and the third action item refers to being a good neighbor in terms of where the university physically sits and the underserved communities and neighbors that are part of all of our campuses across the system and around the state. And then our last commitment to fiscal stewardship. The first goal is to reduce financial barriers to student achievement. The action items here are to reduce student debt, increase campus employment opportunities, and establish a program of full support for low-income families, which the university, as you've heard from Bob McMaster, is pretty close to meeting, but we have a few last mile steps that we need to undertake, noting that this goal should mirror closely to the goal under student success, which refers to making sure that students have the financial resources that they need. The next goal is to align revenue with forward-thinking mission fulfillment. First action item is to think about tuition and pricing. Ironically, the tuition freeze was approved as a result of the pandemic, but may have been an outcome over time and was thought of when establishing this action item months ago. In regard to the second action item around benchmarking administrative costs, you will recall that we presented the self-study on our own administrative costs undertaken by Huron a few months ago that shows how the university sits relative to its peers. That was the first step in helping us identify how to move forward and bring down administrative costs relative to our peers and otherwise. And then the third action item is to continue to look for alternate revenue beyond state support and tuition, and to use that alternate revenue to drive down costs for our students. The third goal reflects the fact that the university's physical infrastructure is a very big and important part of who we are historically in terms of the land we own, the land we sell, and how we grow the physical footprint of the campus. You heard yesterday and before yesterday how we've already begun action item 1, which is to develop a physical master plan for each campus. The other two action items, advancing innovative strategies to support long-term strategic priorities and to establish strategies for land use, retention, and acquisition, as you know, are already underway. The fourth goal is to re-envision risk management and safety. We certainly didn't get to wait for the approval of the plan to start dealing with some of that risk. As you know from previous reports, we've had many policies already in place around risk management and safety. The way we've been dealing with COVID-19 is anchored in our readiness and preparedness, but we need to make sure we're looking ahead, because dealing with the fiscal challenges and burden on our community makes us increasingly vulnerable to other risks, which don't go away just because of the extreme challenge of the risk we're dealing with now. So we need to be purposeful about the next potential risk and our preparedness for it when it comes. Mr. Chair, that concludes my presentation. Thank you. I'm happy to answer any questions.
Thank you. Thank you, President Gable. Before I turn it over to the Regents for their questions and comments, I want to ask you a question, just maybe to some clarification of next steps. You know, many of these action items are, you know, very substantive in their own right. I mean, you can pick a bunch of them. I mean, okay, distributed scaled learning models to stand that up and get that moving, to accelerate new business startups, to enhance our Carnegie community engagement. I mean, these are big things. And so could you comment a little bit on as we reach, as we start to approve these, can you comment on how you're going to approach bringing these to life and bringing them to action, and also the kind of conversation that you want to have on, metrics as to, whether we are actually doing what we said we would do?
Thank you, Mr. Chair. So I would refer you and the other members of the board to the presentations that you've been hearing throughout this third phase of the strategic planning process by each of the vice presidents, because all of the commitments and large-scale goals have sort of a champion or a captain, if you will, who've been working on them. These system-level goals were pulled from the work that you've been hearing about all along. So when Chris Kramer presents his research plan, that informs and is the underlying architecture for the commitment to research. When you hear about system enrollment management as an action item, that is informed by the System Enrollment Management Council and the suggestions that they have made. And you've been hearing throughout the year from Jacob Tolar on medicine, from Michael Go on the different attributes of inclusion, diversity, and equity. And so the notion of how each of these things comes together is through the organizational chart and the charges that we make to each of the vice presidents, and then the presidential cabinet in overseeing how this moves forward. Then flipping the coin, when you think about to the accountability question that you raised in the measures, strategic plans are really designed to create an architecture for storytelling, inspire new ideas and how we move forward, at least at 15%, but arguably and hopefully more, but also to create accountability. And so you need to go in a sequence in order to create that accountability. First, we approve the plan, we decide this is what we want to do, and then we will develop the dashboard. And there's a lot of very well-informed literature structure on how to do dashboards that we would lean into with input from the board, because we want ultimately the board to be satisfied that we're moving forward in the way that feels like we're pushing ourselves forward hard with aspirational goals but realistic outcomes, but also that we're continuing to create the architecture for the storytelling and show all of our constituencies that we're accomplishing our goals, that we're demonstrating our value and impact.
Okay, thank you, President Gable. So with that, what I would like to do is turn it over to all of you for commentary. I'll drop down one letter of the alphabet, and so for purposes of this discussion, we will start with Regent Beeson and then run all the way through to back to Regent Anderson. So Regent Beeson, if you would kick us off.
Well, thank you, Mr. Chair. Thank you, President Gable. I pushed back a little bit on this whole exercise initiative, believing that it's a little early in the president's tenure to be undertaking this. And then in light of the COVID-19 situation, it also feels somewhat premature. But on the other hand, there's no perfect time for this. And I think the way that you're developing out the commitments, they're broad enough, and they're items that are not changeable, probably. Going to the issue that you last asked about, Mr. Chair, we do have a dashboard, and it's called the Maroon and Gold measures.
Absolutely.
And that's the moment of that's the accountability chart that we use and that we've talked about updating once the plan is done. I think it's served our purposes. It needs to be relooked at. This is a new board. The world's changed. The goals have changed. Many have been met. Some have not been. But unless there's a different way to approach it, I think that document is the way we should proceed. Under which administrative metrics and it times well with the HR presentation that we're going to hear later in the year. And those they've taken that to a high level, having analytical metrics for human resources. The final comment I would make is, and I don't know if this is a Mr. Steve's question or to the chair, but I think the last time we've updated our mission statement was 2009, and I would assume that the plan should inform the statement, and that we at some point, unless I missed when we would have last a more recent update around that. And but I'd appreciate the input of the board on that relationship between our mission statement and the strategic plan. Thank you.
Thanks, Regent Beeson. One comment, I absolutely agree with you on the, sort of the central role that the maroon and gold metrics have played in our achieving a number of strategic goals over the last year. And it's really that construct that I have in mind as I ask the question of President Gable. I mean, obviously with a new strategic plan, there will be new metrics, but the overall structure of maroon and gold has served us really well. Mr. Steves, as to Regent Beeson's other question on mission, can you bring to mind any history for us on when we last looked at that?
Mr. Chair, I was just looking up the policy. It was originally adopted in 1994 and was last amended in 2008. It may have been reviewed since then. In fact, I think it has been reviewed since then, but no changes were made since 2008.
Okay, thank you. And, I think we can take that on board as something that we can look at as we work our way through the process. All right. Thank you, Regent Beeson. Regent Davenport.
Thank you, Chair Powell. I want to say I'm very enthusiastic about this plan, and I want to thank you, President Gable, for demonstrating your commitment to shared governance through the comprehensive consultation that you took with the plan within the community, and also demonstrating your commitment to our mission as you took that consultation to the broader community, including our stakeholders in business and industry. You answered my question. The question I had was about implementation and how this plan gets drilled down to the many front lines throughout the university. But I would like to state my expectation is that this plan's outcome, or the outcomes of the elements, really becomes and represents business as usual at the university as we move through this. So thank you for the good work.
Thank you, Regent Davenport. Regent Her.
Thank you, Mr. Chair and President Gable. I'm so very enthusiastic about what I'm seeing. I think, first of all, thank you for listening. I feel in reading it and just taking it in that it reflects some of my thinking, some of the input that I've been able to provide you, limited that it is, and that you are actually listening to me. And so I want to thank you. I really see your heart, your passion, and your interest coming into focus with this plan. And I'll just let you know that I'm definitely interested in all of the commitments, but where you can utilize me, or where I would love to be more engaged, would be the student success and the community and belonging. I think everyone can help where their interests lie, but that's where I am, and I'm very enthusiastic about this strategic plan, and I think we're on the right path. So thank you for your work and your effort.
Thank you, Regent Her, for those comments. Regent Hsu.
Thank you, Mr. Chair. Thank you, Madam President, for this update. I think it looks like things are moving along. I do think that higher ed is going to be changing more than a lot of us were expecting before, and we're not going to be going back to normal. So I think anything that you can build in between now and when we actually approve the report or approve the plan would be appreciated in terms of where we see higher ed going in the future. Including things like enrollment management strategy was mentioned or is mentioned currently under Commitment 1, and I think that that is great. And we had a little bit of a discussion yesterday about that, and it wouldn't be a discussion about enrollment management if I didn't bring up test optional, as everybody knows. So I think we should really be considering that. Especially even in a temporary form in the next admission cycle. That would be excellent. And then also I think we're learning a lot more about online, and I think online is going to be a bigger part of higher ed in general, and we should be looking at how we can capitalize on that. And then the maroon and gold measures will have to be updated as we get through this. I think everyone realizes that. And lastly, I think one of the topics that is on everybody's mind is what will happen to athletics through the pandemic. And I think athletics is glaringly missing from the strategic planning. And I think, as I mentioned before, I think it should be part of it. Thank you.
Thank you, Regent Hsu. President Gable, Regent Hsu's comments on enrollment, online, maroon and gold, anything that sparks, further clarification or commentary from you?
Thank you, Mr. Chair, and thank you, Regent Hsu, for the feedback. I think as we get into the nuances around execution and start thinking about the update of the, as Regent Beeson aptly described, really transformative maroon and gold measures that were the anchor for the institution, is where most of that nuance in the discussion will happen.
Okay, thank you, President Gable. Let's move on now to Regent Kenyana.
Thank you very much, Mr. Chair, Madam President. Want to thank you for bringing this forward and it being as timely and robust and incorporating feedback. I mean, I think there's certain things I read here and I remember those discussions from our last discussion, and I can see that the feedback that we discussed has been added in there. So appreciate you doing that. And I'm sure you did the same with all the other stakeholders. You could have brought the same one, and I know a few of them wouldn't have noticed. But so we're glad you did incorporate that feedback. All this stuff is great, and I think we can talk all day on most of it. I'll just make a few comments. First, with respect to Regent Beeson's comments about the timeliness, I agree with part of that. I think it's an appropriate time in your tenure to be addressing it. But to his latter point, certainly as the COVID crisis does evolve, if you do ever feel that it's not an appropriate time to continue the work, I think we would all understand that and not really question your ability to carry both. So as long as they can both be carried out, fine. But if that ever is an issue, I think we'd certainly understand if that affects the timeline of this. At least I would. Just want to highlight a few things that others have said. Obviously, the crisis certainly has highlighted some of the things that we already were talking about here, healthcare and online learning and whatnot. Also want to point out how interconnected a lot of the things we talk about here are. I've said this before. For example, we talk about wanting to recruit and retain a diverse staff and faculty, and that's completely dependent on doing the same thing with the students, and vice versa. So, just a lot of this stuff is very interconnected. There's a quote in here I liked about meeting students where they are in terms of student success. That could be interpreted also as an argument for just reevaluating access. And in terms of, some might argue that there are students that we're not meeting where they are because their ACTs at a certain level, more specifically Minnesotan students. So just something that popped up in my head as I was thinking about that. And then lastly, really want to highlight the climate action plan that was called out in there. As you so aptly said, that's so important to our students. I think it's partially a generational thing. My generation cares about it very much. And on every campus, we're seeing action and conversation about this. Most recently, I think there was a student referendum on the Twin Cities campus about this as part of the elections that some of you may have seen. At the February board meeting, colleagues, you received those Valentine's Day notes from the climate action plan. I remember it very well. It was the only Valentine's Day note I got this year. So I appreciated that. And then at March, we received these notes, and they were on my desk here. So I was reading through them. So I think it's very important to our students. And by the way, as I was reading these, apparently there's seeds in these papers, so you can plant them. So that's interesting. But anyway, it's a huge issue. It's important, period. But then you have to factor in how important it is to our students and the generation coming through our classroom. So I'd really love to see that elevated. But great work, and look forward to continuing this conversation. Thank you, Mr. Chair.
Thank you, Regent Kenyana. Regent Mayron.
Thank you, Chair Powell and President Gable. My comments to this go from the general to the more specific. So let me start first with the general comments. I actually am thrilled that we get to take a pause or move aside from the COVID pandemic for a moment and be able to focus on where we ultimately would like to see this university go, wherever that new normal ends up being. So this is a very exciting thing to be engaged in, particularly against the backdrop of what we're dealing with the COVID pandemic. So I'm thrilled to be engaged in this part of the discussion right now. Second of all, I wanted to share that your explanations of what these goals mean, and in particular the action items under them, I think are critical to anyone understanding what the strategic plan is. So my hope is when the strategic plan is ultimately put to the board for adoption, it will include some of that narrative that you provided to us, President Gable, under each one of these commitments and goals. Because I will tell you, as someone who read it and wasn't able to participate fully in the March strategic planning session, when you read them without your explanation, they don't come alive, they don't stand out. I couldn't pick it up and know what you necessarily meant or where we were going to go with these. So I do think the explanations really are critical and should be included in any strategic plan that ultimately we adopt. My third comment has to do with the metrics, and I think I need to make sure I understand whether when we adopt the strategic plan, will it include metrics, or will we adopt the strategic plan, which includes the goals and action items, and separate from that, metrics will be identified, which we will adopt. So I'd like to hear from President Gable whether you see the strategic plan including the metrics, or whether that would be a separate item after the strategic plan is adopted. And on the issue of metrics, to be honest, in part because I wasn't here when the maroon and gold measures were implemented, it doesn't much matter to me how these metrics, what they're called, or whether they're under the maroon and gold. If there's another best practice in order to identify metrics and be able to state them, I certainly would be open to whatever you proposed. It doesn't, for me, have to come back in terms of the maroon and gold if there's a better way to state metrics. My fourth and fifth comments are more specific, and that is particularly under commitment one, when I looked at the goals and action items, sometimes the words establish are used, sometimes the words developed are used, sometimes the words are develop, establish, and implement are used. I think to the extent that we're talking about developing or putting in place new goals, and ultimately we intend to implement them. That's the point of the goal. I think using common language among those various commitments and goals would be helpful for us to understand, but anybody else who were to pick up the strategic plan going down the road. And my last comment had to do with under fiscal stewardship. There is a goal there, goal 4, where it says re-envision risk management and safety. It's not clear to me why safety falls under the fiscal stewardship commitment. I certainly believe safety needs to be addressed, but I'm not sure that it's under the fiscal stewardship commitment, and perhaps we'd be better served by stating it under one of the other commitments, perhaps under commitment 1 or commitment 4. I'm not quite sure where it goes, but it doesn't seem like it really fits there. That was my reaction to that. So those are my comments, Chair Powell.
Okay. Well, thank you, Regent Mayron. And President Gable, well, first of all, Regent Mayron, I think when you said you were thrilled that we're actually working on something other than COVID, you probably heard a lot of amens, coming through. So, President Gable, I heard at least three questions that you may want to comment on. The first one was metrics, and how and when are we going to, establish those? And then I heard, the suggestion to use common language around the action items, and then a point on safety. And so I heard those three. You probably heard others, and also the suggestion that the action, they really come alive with elaboration. And obviously the presentation we've just looked at is pretty bare bones in terms of the narrative. So would you like to comment, reply to any, or elaborate on any of those suggestions from Regent Mayron?
Yes, thank you, Chair Powell, Regent Mayron. So I'll just go through them in the order that my notes say, if that's okay. So with explanations, what would normally happen, and I think we can still do this despite the way in which we're functioning, the institution right now, is upon approval of the plan, then we would get into things like document design, video supplementation, ways in which a person simply looking at the plan could drill down to understand better what was going on. In most operationalizations of the storytelling, in my experience, that happens much more easily when you have the dashboard or whatever the next chapter of the maroon and gold measures we have done, because a lot of the understanding of what we're trying to do comes in how we measure whether it's happening. And so when you build out a website and it has the ability to see the dashboard in real time, transparently and publicly as we would do it, it is, and then has some narrative around we're measuring this because we had this goal and here's how we achieved this measurement, is often how in that two-dimensional part, when you can't have a conversation, how the general public generally comes to understand what it is what we're trying to do. And I've seen that work very well. It's an iterative process, which sort of takes us to the second question, which is the metrics would be approved separately and as a second chapter. So you approve the architecture of the plan, and then when you have agreement about what that is, how you measure it, there are ranges of options in how you measure. And so I think that would require separate consultation, review, and action that I would like to start at the July retreat if the schedule is maintained. In the way that our retreat last year in Faribault, I think many of you see pieces of those conversations still informing everything we're doing today. That to me is the most effective and efficient way to get that shared sense of what it is that we want to do around accountability in the formation of the metrics. But we would do it in whatever way the circumstances allow, obviously. But in any case, it would be after the plan itself is approved if we follow the current structure that the phasing of the strategic plan that we proposed. Common language, absolutely, that we can work on that between now and a final plan. And with regard to safety, so I have two thoughts on that. And these are thoughts as a response that could inspire further discussion if it doesn't satisfy, and we could do during the review period between now and the next time we talk, or maybe they're an answer. I'm not sure. They're somewhere in between. But the first thing I will say is a reminder of the overall architecture of the plan, that there are pieces of different things we want to do as an institution that sit in different places. So we talk about affordability under success, even though it's really a fiscal enterprise. And we talk about lowering debt and making sure families whose total family income is below a certain level would ultimately have available to them full financial support for their child's education, which is a financial question, but also a question of belonging and access. And so there are intersections in all of the action items, and safety would be an example of that. The reason it today sits in the fiscal goal is because the safety function in the org chart sits under the CFO. So it's an operational effort to create the safety, the police force, the maintenance of our buildings, OSHA compliance, all of the sort of regulatory notions of safety sit in youth services and fiscal. And so the responsibility for it is demarcated as part of our fiscal commitment. But the reality is, if I may interpret your question is that safety is also referred to as part of belonging, right? And feeling like you are a part of something. So I think that we need to, there's probably some editorialization that could clarify that, so that when we say safety, we mean all types of safety, and it is infused throughout the plan without removing the safety in the sense of, you know, I think of for some strange reason in these crazy times, a Roadrunner cartoon of the boulder falling on your head safety that would be part of what the CFO and senior vice president broadly is responsible for. So I'd like to take a swing at using language to resolve that rather than shifting that entire component out of that part of the plan itself, if that is amenable.
Thank you, President Gable. Regent Mayron, any follow-up?
Just a couple items. Thank you, President Gable. You know, part of the reason for the explanations is not only so that when the publics read it or our various constituencies read the strategic plan, they have an understanding, but it's also will become a guide for future regents as well. As when you come on board, the first place you want to look is at the mission and strategic plan, and to make sure that our incoming regents also understand what we've committed to in the direction that we're moving. So that's why, to me, having the explanation as part of the strategic, ultimately how it gets communicated is so important. On the issue of safety, I understand why you may have put it there, particularly because that function falls under the CFO. But again, thinking back on our July meeting from last year and what we were focusing on with fiscal stewardship, and that being such an important commitment, I really think looking at putting that safety piece somewhere where I think it has more to do with the community and well-being and than I do towards what's involved in fiscal stewardship or what I think about it. I would just suggest taking a look at whether that could be placed elsewhere. Not have it there. It needs to be there. It's just a matter of where. And I don't want to dilute our focus on fiscal stewardship. That's my own personal feeling about it. Thank you. I have nothing further, Chair Powell.
Thank you, Regent Mayron, and thank you for those follow-up points. I'm going to move on now to Regent McMillan.
Thank you, Chair Powell, and thank you, President Gable, for the commitment you've made to keep this moving despite detours and roadblocks and a million other things coming at you, not the least of which has been COVID. I think context is important here, and I'm very appreciative of the context. Several years ago, we challenged your predecessor to begin work on a system-wide strategic plan that could create a blueprint, and I'm going to steal that word perhaps from Regent Rocha. I don't know which of us used it. I know he used it. We had a lot of our thought come together around how do we build a system-wide strategic plan that can then be a blueprint around which we manage our fiscal resources and make investments that reflect that system-wide plan. So I think you've delivered. You've helped us move from a collection of campus and collegiate plans, some of which are strategic, some of which weren't all that strategic. But we now have a framework here that we can start to build all of these pieces of the puzzle. And I think it's going to be critically important that you remain fluent and engaged, fluent in this terminology that I love to see sprinkled about this plan outline, but also engaged in the system-wide nature of this. So thanks for that. The plan is a framework around which we can build and work. A lot's been said already, and I won't add to it about the importance of building the metrics, the maroon and gold, rebuilding those perhaps, at least having the board engaged periodically and robustly in what those should look like as this system-wide plan begins to build out from the framework that you've created. So I would also echo Regent Beeson's comments about HR analytics. What sat in the back of my committee's information item yesterday should be 101 reading for all of us. about that analytic work in the HR side of the business that can inform so much of this and give us some tools with which to go forward. I'm very pleased to see that I like these words. They're created words, but your predecessor created one around MinDrive. I guess that's an acronym. You've created something of an acronym word blend with Mintersections. They're fun words, but what they really underscore is that we're here for Minnesota. And I'm glad you're moving forward with MinDrive, but building your own piece of this in Mintersections. And I don't think we can have enough of that in a plan. I also like goals that come with action items. That it's not that hard to write a goal. It's hard to write what the goal means, and the action items begin to create that framework for building goals into something that the employees, students, and our stakeholders can all get their head around. So all that's good. Here's my question, and Regent Mayeron already brought the maroon and gold piece into a chronological focus, and I want to do the same with the budget. The fiscal framework around which we fund the activities of this university needs to evolve with the development of a system-wide plan. So I'm curious, and I don't know that there's a good answer to this, but you just did a nice job of articulating how you'll bring the maroon and gold along. I assume the budget, as we not build the 2021 budget, we talked about that yesterday, but as we get to a new biennial budget, talk a little bit, President Gable, about how you see this plan as it unfolds informing that new biennial budget, which will actually be your first full-blown budget, if you would. I think that's very interesting, and I think it's iterative, and I think it's probably got to be informed by COVID a little bit, but give the board your thinking in that space, if you would.
President Gable.
Thank you, Chair Powell. Regent McMillan, well, thank you for the positive feedback on the plan. And yes, you are correct that any twinkles in our eye that we had about the next biennial have been modified in light of the current circumstances and what that's likely to do. For example, we previously would have assumed that as part of the reallocation process that we go through across the system, we would have some resources pulled aside to invest in specifically items that would emerge or be proposed as part of the strategic plan, and that we would make those investments as those ideas come along. Our capacity to do that may very well be affected by the resource challenges that we have, if not fundamentally delayed, to be determined, as the different scenarios and contingencies start to take on the progress from possible to reality. So I will say that there are, in the way that a strategic plan is often largely anchored in simply re-articulating and emphasizing what an institution already does well, layered with appropriate infusion of new and progression, is the same way that I think of how we do budgeting, that there are really well thought out components of what we do around resource allocation that make a lot of sense and have brought us to where we are now and have allowed us to be the institution that has done all those things that you heard listed out earlier today, and then some. But that there's always room for the infusion of appropriate newness in what we're doing. So we have an aggregated goal within the plan of aligning how we distribute revenue to the fulfillment of the plan and to mission fulfillment. The Huron study was the first step in that. There are other layers to that I've referred to in previous reports where we could start to think about our formula and whether it's time to look at the formula that we've used in the past and think about what it takes in the future. That is a longer process than what would happen over the summer as we lean into the next biennial budget, but it can be anticipated in how we lean into the next biennial budget. I suspect that the plan will help us, along with the recommendations of the working groups, will help us as we think about how we fulfill some of these goals in the short term. There are many enduring components of what we envisioned months ago that are exactly what we're going to be doing for the next few months, like what we're doing around distributed learning, like what we're doing in the health sciences, like what we think about around food and agriculture, what we're doing in order to maintain fiscal accessibility, a sense of belonging. If anything, we are doubling down as a result of COVID-19 rather than having them delayed as a result of COVID-19. But I think the way in which this plan helps to inform us is simply by giving us the talking points in the architecture as we have to make tough choices in the next few months. And then as some of those tough choices fall away and are replaced by whatever the new normal is, what we would prioritize, both in our legislative asks and what we would present to you, and then in what we would invest in with the resources that we have.
Thank you, President Gable. Regent McMillan, any follow-up?
No, much appreciated that answer, and look forward to working together to turn this from a framework into a working plan that we can deploy on behalf of this university. Thank you, President Gable.
Thank you, Regent McMillan. Regent Rocha.
Thank you. Thank you, Mr. Chair, and thank you, President Gable. There's a great deal to be excited about with how this plan is developing, and I'm pleased to follow Regent McMillan. He covered some of the concepts, and I think did much better than I in explaining some of the genesis and what at least what I'm looking to the strategic planning to provide to the board for guidance as we move forward. As one of the few opportunities that we have, I will touch on just a few different things. First, I could not give higher marks to your efforts to get outside of the university to get input, as well as Regent, I believe it was Regent Davenport had talked about the shared governance and including and really relying on the institution and the experts and leaders within the institution to help guide this. But your process for getting to state leaders and community leaders, I couldn't give you a better report or better grades on what you've done there. So thank you for that. Excellent work. As we go through this, I mean, we're now getting to some really good substance, and I'm pleased to see this in this way. Going on just a couple of things. One of the things that stands out to me, and part of it is just background. We talked about advancing the natural resources and agri-food systems. And with respect to agribusiness, I'm really happy to see that in there in this way, as far as expanding, developing, retaining agricultural and food system talent in agribusiness. One of the things I would in one of the first slides, it talked about bolstering, can't remember the exact word, but bolstering the national and international standing of the University of Minnesota. I would actually say that in this particular area, when you talk about ag business, in food systems, we need to really shore up our standing in the state and our role in the state. Not many years ago, it was unquestioned that the university was where you found your development of talent in agriculture, agribusiness. And right now, I think there's a little question out there as to the university's commitment. And so really, again, establishing ourselves and putting that stake in the ground that this is where the state looks for that expertise. We have the resources, you clearly are aware of that. So that's a point that I would just emphasize, that really making that commitment and then coming up with a way of measuring how we have achieved that, I think would be very helpful to build off of Regent McMillan's commentary. I want to talk just briefly about the fact that I don't bring something up doesn't mean that I don't have a thought about it, or that I'm not very supportive. But just for economy of time here on financial barriers, one of the things that we talked about, the goal 4, I think it was engage in continuous improvement to promote efficiency in all aspects of operations. From my standpoint, and looking across higher ed as a whole, and looking at how the state and governmental leaders have concerns with respect to higher education, I would like to see us actually establish some goals for how we're going to move as many of our resources as possible away, toward accessibility, toward the education, research, and so on and so forth, and specifically that if we can reduce the cost of operations, and I guess the common nomenclature is administrative costs. We know it's very complex trying to figure out where one ends and one begins. But I think continuing down that road and trying to make those improvements will help our standing and yield better support from the public and from the state. We talked about, in your financial barriers, the tuition-free program for low-income families. I've been exposed to this in the past, but this is, I think, this conversation is the first where I've seen that specific plan. I don't know if that is the right plan. My biggest concern is that when you start to create different categories of students, you start to create some division. And I think that aid targeted to students with that demonstrate need is a better way than to come up with a different way of actually assessing tuition. I note that at the outset of the university, in the territorial constitution, that says the admission fee to the university, charges for tuition in the department shall be regulated and prescribed by the board. And as soon as in their opinion, the income of the university fund will permit, tuition in all departments shall be without charge to all students in the same who are residents of the territory. Well, obviously, we're a long way from that, and I don't expect the university fund to change dramatically in the short term, but we do have an excellent foundation. And in years past, we've had focus on philanthropy for the purpose of providing financial aid to those that are in true need. I would much rather see us follow the old rubric of the best financial aid is low tuition, and that when you take some people out of the mix, it gives you the false sense that tuition is not a problem. But for those students that don't qualify for that low tuition policy or don't qualify for the aid, and who don't have the kind of support that at least on paper we believe they should have, it's very difficult, and they're the ones that end up being lost on the wayside. And I think that's a tragedy. So I would rather we focus on aid to students and set a goal for dramatically increasing the aid available versus tinkering within our the way we assess tuition to different students. And on that same point, when we talk about on-campus employment, again, this is an age-old conversation. Is on-campus employment a way of efficiently delivering services for the operation of the university, or is it a form of financial aid, or is it some mix of the two? So I would just simply say that on-campus employment, I think, if it's available to have student employment meet the needs of the institution, I think that's great. And I think that it's efficient. I think that it's great for the students. At the same time, I would not want to necessarily create a works program where some students are then subsidizing other students through employment and so on. I realize these are very, very specific examples, but again, lacking another opportunity to have that conversation. I think that's important. To bring it back into the broader, again, going off of Regent McMillan's comments, I really, want to, the question that I always put in front of these discussions is, how does this plan guide our budget processes? How will I evaluate your next budget against this strategic plan? And I think you've made remarkable progress in getting us something that is, as we have these conversations the next couple of months, I think going to provide that promise to assist us with that. But I agree with Regent Mayer on that some of the language as it is, and you've already addressed this, so no need to do it again, but that clarification will really help us understand what this is saying as far as what our priorities are in that budget process going forward. And I would just add two last quick points. One is that these are living documents that as situations change, whether it's a COVID situation or whether it's other sea changes in higher ed within or beyond the state, we will have the ability to continue to refine and address these things. And we actually should at some point talk about how long we expect this plan to be in place before we would have another major review on that. And so from that standpoint, I think you're dead on track. This is really good. And then finally, I'll just say that as we put this in place and as we start moving forward, I'm going to struggle a little bit in the next couple of months to understand how this plan, as Regent McMillan identified, how this helps me understand what the role of our various campuses are and what priority we have toward expenditure. And so we may not get there exactly here as far as maybe I would like to see, but that is an area I'd like to see more clarity, because otherwise, if it's so generic, then you find this concentration on the larger campus, and these other campuses sort of just become these somewhat individual entities, and I would really like to see us really work on that system-wide concept, which I know you've got a commitment to as well. But I think that we need to be part of a bigger dialogue across the state. And once we have this plan in place and we've kind of identified who we are, who we plan to be, I think that you can see some sea changes going on in student demand. There are going to be huge financial issues with all of our systems in the state. And I think there should be a bigger dialogue in the state. And I would like to see President Gable be a leader in that as we talk about these major changes that are coming forward. And when I look at our plan here, understanding how it differentiates what we do compared to other institutions across the state, the more that we are able to clarify that as we go forward in this plan, I think the better we are able to play a leadership role, and the president will be able to play a leadership role in that statewide conversation. So I know that's a lot. I appreciate your time. Thank you.
Thank you, Regent Rocha, for those very good comments. And President Gable, I'm going to ask you to respond. I wanted to. There are a lot of good points here. I want to underline a comment that both Regent McMillan and Regent Rocha have made, having to do with sort of the role of the campuses, in the plan. And there's a couple people who raised that. And maybe if you can just comment on how you give us a little bit of a sense for how you see the individual roles of the individual campuses as they add up to the full strategic plan.
Thank you, Mr. Chair. Thank you, Regent Rocha, for that feedback. We took furious notes and will use it to think about what comes forward the next time we discuss it. But with specific regard to your comment, Chair Powell, that is, at the end of the day, the quintessential challenge of systemness is that each campus has an individual identity that makes a palpable and important contribution to its faculty, staff, students, its community, and the state. And it's in that collectiveness that we as the university system make our contribution. So you don't want a plan that in any way dilutes or chills the contribution that each campus is uniquely capable of making, and yet reflects a set of shared points of forward momentum that can be looked at in the aggregate. So the chancellors know that they are to have their own strategic plan that reflects what their campus does, but that strategic plan needs to be written and have a set of measures that would then plug into what the system plan is and how the system maroon and gold dashboard of the future is written. And we've been talking about that all along. The chancellors who were at different phases of their own strategic plans have been updating to reflect the progress that we've been making as a board, either by having an overlay of an existing strategic plan, if that's the phase that it's in, or by pivoting their own strategic planning process to reflect the commitments, goals, and action items that have been emerging over the course of our review since last July. So we need to have an architecture to talk about everything we do and do well and with impact that leaves real room for each campus to be itself. And we think that's what this plan does.
Thank you, President Gable. Any other thoughts or, on Regent Rocha's good points? I mean, there are a lot of them, but any other thoughts that they sparked? And I know that he's not expecting kind of, you go down them point by point.
I'm tempted to, but I won't. I'll just say that it's received and heard, and we'll look at where that results in immediate modification or in the long-term plans for implementation according to the different points made.
Okay, very good. Let's move on to Regent Simonson.
Thank you, Chair Paul. Thank you, President Gable. I really appreciate you moving this forward in the midst of all you're doing with the COVID too. So it's busy times, but I really look forward to seeing the sections of this strategic plan roll out. I like the way you presented it. Obviously, in certain areas I focus more on than others, especially the agribusiness part of it. Also, the alternative sources of revenue. I'm very interested in seeing that roll out. When I think of alternative sources of revenue, I think alternative to tuition, for example, where that's out. But also, an area that I've mentioned before and I'm very interested in is reaching out to our diverse population. I think commitment 1 and 4, somewhere in there, yeah, those types of things. And, you know, here in Worthington, now we're a small community, but we have a lot of students, and over 50% of our grade school are from immigrant families, and many different dialects involved in this. And so looking forward to specific programs, how we can reach not just here in Worthington, but other areas of our state where we have the same situation, how we're going to reach out to them more. Things like online might be one way to start with that, but I'd also like to look at using our extension more. We have an extension office here in Worthington, and we have a STEM program here too, but extension spends a lot of time like with 4-H, but can they do more to reach this first generation students? And so those are areas that I really look forward to seeing more specifics on, and as you roll this out. So thank you very much.
Thank you. Thank you, Regent Simonson, for those comments. Regent Swigum.
Chairman Powell, my thanks also to President Gable and her team for giving us a guide, kind of a path of where we're going to go and why we're going to go there. I think that's very, very important. Now, that's not to say, President Gable, that I would be on board or supportive of every one of the goals or action items. I do have some concerns that would be raised amongst some specific goals and action items, but as a comprehensive plan, I think it's a good job. It's well done. My caution, my suggestion, my advice would be that we don't do the strategic plan just by ourselves, Joan, that we include our other partner in public education, higher education in the state, Minnesota State, and that we coordinate, collaborate with them as they look forward to their strategic plan they have as well. And I think in serving Minnesota and serving Minnesotans, students and taxpayers, this plan needs to be coordinated and collaborated with Minnesota State. And that's all I'll say at this point.
Thank you, Regent Swigum. We've heard a number of regents, President Gable, talk about opportunities for coordination with Minnesota State. That's really an important opportunity. Any thoughts or comments on that issue, which has been raised by a number of regents?
Thank you, Chair Powell, and thank you, Regent Swigum. I agree. Regular conversations with the Chancellor. I presented this plan to the Minnesota State leadership team. We've talked specifically about some of the goals and action items that overlap in the short term and in the before the plans were even approved. We were collaborating on the mental health initiative. We were collaborating on inclusion and belonging, and we've had discussions on how we can collaborate on distributed learning. Those are somewhat trees. I know you're talking more about the forest, but it's a starting point for thinking about where we can work together to create economy of scale and serve the state in the best possible way.
Okay, thank you, President Gable. Let's turn now to Regent Anderson.
Paul, I won't be long. I noticed on the agenda we've still got a lot of stuff to do, and we've been here quite a while already. I'll just make a comment. I'm generally not a process-oriented person. I'm much more results-oriented. I'm just going to make a comment on the strategic plan about results. We came a long way from when former Chancellor Lemkool and Vice Provost Ropers brought us on this. My take is we've got a large and a wide plan. On the other hand, we serve a large and a wide constituency. So I think that's okay. But I think the real take on this strategic plan will be the results that come from when we start drilling down on the action items. And that's what I'm waiting for. All the rest is kind of hoopla to me. I'm looking for eventually the potential to drill down and have flexibility as we drill down on those action items. I don't need any response. I'm happy where we're at. I'm glad where we're going. That's it for me, Chair Powell.
Thank you, Regent Anderson. And Regent Kenyana would like to make a very brief second comment.
It is indeed very brief. Thank you, Mr. Chair. I was just going to react to the conversation I heard between Regent McMillan, um, the president, and Regent Rocha about the campuses and their roles. I certainly agreed with a lot of what was said in terms of it really is the campuses place and their chancellors and their leadership and their shared governance model to really figure out how they execute on their mission. But I do think what their mission is and what their place in the system is does belong in the strategic plan in a broad way in terms of just where they're placed, and then the campuses themselves can tell us how they execute on that unique model. And that's my brief comment, Mr. Chair.
Thank you. Thank you very much, Regent Kenyana. And I think President Gable would agree with that commentary. Yes, I see her nodding. Thank you. And then I'm going to do one more, and then I really think we should close this off because we do have quite a bit more work to do. Regent Rocha would like to make a brief second comment.
Thank you, Mr. Chair. And just right off of what Regent Kenyana just said, and ultimately that was the point. I would also point that we talk about reaching communities that haven't been served or that haven't been served as much as we would like, that we consider underserved. We have a major geographic issue with rural kids and as well as students in core cities and so on. And that's why talking about the system plans, the campuses across the state, not only are they their own thing, but they're also resources for the system. And the capacity for us to meet those goals, including geographic reach for the institution, I think that's really critical, and I hope that continues to be part of the conversation. Thank you.
Good. Thank you, Regent Rocha. Thank you for that. Let me just conclude by saying that maybe we're finishing where I started. This is very substantive. There's a lot of good work that's been done here. We have, as with President Gable, we have a lot to do here to do, as Regent Anderson said, kind of the drill down and really start to bring these action items to life. So I know one of the things that we'll do with President Gable, here over the next weeks and months is just to make sure we've got a very clear, and Mr. Steves, a very clear plan for how we start to bring all of these topics in front of the board for review of the strategies and the action items. There's a lot of work to do here, but it's very well directed, and I think it's going to be rewarding for us as a board. So with that, we're going to take a break. We'll take a 5-minute break. Everyone will be back at 11:37. So let's just take a, oh, wait a minute, it's 11:37 now. So we'll be back at 11:42, 5 minutes, and we'll move on to the next item. Are we all back? Mr. Steves, maybe we can do a quick roll, or how are we doing?
Mr. Chair, I think you can go ahead and proceed.
Are we ready to go? All right, thank you. We're moving on now to a discussion of preliminary impacts on academic health enterprise in the medical school as a result of the pandemic. We began the discussion of these preliminary impacts of COVID-19 on the academic health enterprise and the medical school at our last special board meeting. At that meeting, we reviewed a resolution related to deferment of University of Minnesota physician clinical revenue transfers. And today, that resolution is before us for action. Joining us are Dean and Vice President Toller and Mr. Peter Mitch, the Chief Financial Officer for the medical school and the University of Minnesota physicians. President Gable, would you like to introduce the item?
Yes, thank you, Chair Powell, Vice Chair Swigum, members of the board. As you described, today's discussion follows up from the board's April 21st review of the University of Minnesota Physicians Clinical Revenue Transfer Resolution, which is brought forward for action today. I would just like to take a moment to recognize the work of our medical and research enterprise during the COVID-19 pandemic. Their efforts really have been nothing short of inspiring, and they are the epitome of what it takes to make us UMN proud, with particular thanks, of course, to Dr. Toller and his team and all those on the front lines of the challenge who are working to keep us healthy, safe, and well. And with that, I will turn it over to Dr. Toller and CFO Mitch to continue the presentation.
So before, Dr. Toller, before you take it away, let me just remind Regents that this is before us for action today. And before we move on to, okay, we'll go on. We'll let the presenters take it away now. Dean Toller.
Thank you, Chair Powell, Vice Chair Swigum, President Gable, Regents. I am, as always, grateful to be given an opportunity to talk to you with the accomplishments that I see as glorious and noble on behalf of the medical school, the UMP physicians, and the clinical affairs at this university. It is, however, a unique situation when we have an epidemic at our hands, as well as the economic crises, and we have to survive both. And as the president and several of you have said, and I'm just going to amplify, if a return to normalcy is our goal, we have failed. We have failed to learn because the vulnerabilities that have been surfaced by this epidemic and the opportunities that have run parallel to that are just too precious to miss. And it has been the light that emanates from the university and academic pursuits in general that made it all possible. And what makes the fire burn is the space between the logs, and that breathing space you have created by your phenomenal governance and attention to the integrity of the university. So it is an honor and a gift to serve this university, this state, this president, and all of our communities. Next slide. So we exist to be prepared. We exist as land-grant university, and I really like what Regent Beeson said on what happened in 1862 with the founders, going back to the Northwest Ordinance that started it all. It is, as many American documents, as many documents of American history, some of the best ones written by mankind, and it says that the knowledge is necessary for good government and the happiness of mankind. It's difficult to improve on this, and We are here to serve. We are expected to be prepared, and we trained for this. So the faculty responded to the COVID-19 epidemic as you would expect, and excelled in many ways that were perhaps a little unexpected. So we put up the molecular testing that the president described in 5 days. This needs to be almost felt, how important this has been and how phenomenal the leadership of Dr. Yoi and her team has been in this. We have a number of clinical trials, and we were the first place in the union and perhaps internationally that has treatments and prioritized the treatments in a way that it spanned the whole COVID-19 disease itself. And we are the place that is being looked at nationally and internationally for delivering an information and action that leads the whole COVID-19 response. We have started the rapid response grants, and we have worked. That's the space between the logs that makes the fire possible. We have teamed with other colleges, College of Science and Engineering, Institute of Engineering and Medicine, College of Design, School of Nursing, College of Pharmacy, and that produced what you have seen perhaps, the masks, the ventilators, the safety shields, all that good stuff. Next slide. You've all heard of the testing, and I'm not going to repeat what I said earlier this morning about the genesis of this, but it is a phenomenal example of how ingenuity that is, in my opinion, only possible on the academic ground, because it does encompass that medicine is a research program. Medicine, anything good in medicine that I know that exists today or existed in the past has come from research, from better understanding. But it's not the whole thing. In the United States and elsewhere, it is no longer the doc with black bag and several ancient instruments. It is the system that provides for that patient. And that is the system that we were able to engage with my colleague and friend, James Hereford, and other partners across the state, most notably the Mayo Clinic, that has made it possible, that has made it operational, that has made it possible to deepen the understanding of the disease and how it spreads and what does the antibody actually mean and how can we, as Regent Xu asked earlier, how does this make us better equipped in decisions that will bring people back to work and that will resume the operations of this university. Next slide, please. The University of Minnesota physicians are on the front lines of the COVID care. As some of you know, I am not in favor of using the word heroism because it is usually used by people who have never seen intensive care unit. It's a hard work. It's a hard daily renewal of commitment to the craft that we represent and to what university and its medical school represents. It's a more in the realm of decency. This is what I trained for. This is what I'm here to do, rather than a heroic effort that would be somehow perhaps misunderstood in everything that popular culture associates with heroism. It's a much deeper sentiment. It's a much more cardinal virtue than the appearance of this. Now, our system is the only one, the first one out of 10 now, I think, including the ship in the Hudson River, that had the COVID-19 hospital. It was a brilliant effort, brilliant idea, not mine, so I can say that. And it happened because of the partnership that we have with the Fairview Health Systems. And we have been able to really stay ahead of the game in a way that we provide the regular care as well as the COVID-19 care. And it was everyone. It was the administrators, nurses, physicians, staff that were leading the operations in the hospital. We have 3 now. The standard of care and the quality has never been diminished. And again, if there is an example of how the system can lead and can really enable the goodness that is available to us all, that would be this example. And that's what Regent Kenyana so well said, that character is revealed in crisis. I would just amplify this and say that character is a sum of choices. Character is a habit. Character is not a flash of brilliance. Character is that you show up in that ICU day in and day out. Next slide, please. So we all have been watching the modeling in one way or another, and I think it's almost like a soap opera sometimes, because there are so many different prognostications, there are so many different ways. I'd like you to consider this time about a month ago. So this time a month ago, we all were told that around now about first week of May, all the hospital beds in the metro area will be taken, that we will be past our capacity in ventilators, in ICU beds, in intensivists, and we will be just looking at each other, trying to decide who gets a ventilator and who doesn't. That was the prediction. That was the theme. And as in any history, it helps, I think, to go back to how these predictions panned out. They didn't. And that's the whole point. The whole point of prognostication, in my opinion, is to change the reality, to change the future. And that's exactly with your leadership, your governance, with the President Gabel's direct support. That's exactly what happened. That is where the clinical trials, the testing ability, the grants, the COVID-19 hospital, all that ventilator for that matter, that's where it became so important in bending the future to what we desired the future to be. And our academics, chief academic officer in the Joint Clinical Enterprise with Ferry Brad Benson, has been leading this effort. And it continues to be an agile system. It is impossible to predict what will exactly happen, but it doesn't matter. If you let me, there are essentially three things that you can look at this graph and read through it, or if I can explain a little better, there are three different ways you can look at the future. One is an acute scenario. We will have 200 patients by summer. Q3 is going to be fine as far as the economics of healthcare goes. I can speak about the higher education later, or economics in general later. The second model is a subacute one, which is about 300 patients, 2 peaks, and again we would be back, for Q3 and able to resume most of our business. And then there is the chronic one, which is, as Regent Simonson asked about the 614 mutation, that really is, quite a possibility as well, which is more than 1,000 patients and no real recovery until probably Q1 2021. The development of the vaccine and the herd immunity is going to play in a very dramatic way in this. But I would argue that what we learned from the modeling is that the constant adaptation, the constant readiness, and the understanding of the bookends, what is the worst case scenario and best case scenario, is really the most useful intellectual maneuver that we can contribute, not just to each other and to the leadership of the university, but also to the state, as you have heard, and how we can really navigate this with agility that is not easy to navigate. And the variables, of course, include the Restore program. The Sunrise is actually a much better word, program that is equally relevant in education as it is in clinical enterprise and as it is, as VP Chris Kramer said, in research. The Surge, which is one of these three models, is another one, and the external support is the third one. And Regent Swigum is absolutely right. We are not afraid. We are as aggressive as we can be to get support from elsewhere. But as you all know, the choices of freedom are limited. Next slide, please. I will turn in a minute to our CFO, Pete Midge, but quickly recap our conversations we had about this before. And again, I'm grateful for your wisdom and guidance of Brian Steves and Doug Peterson and others. But to say the obvious, UMP, the physician, is a faculty practice plan for the medical school. It's a clinical arm of our school. And that is why we are relevant to the state. This is why we are able to say we train most of your physicians. Chances are, 70% actually, that your physician is somebody who graduated from this school. That's how we care for the patients. That's how we deliver the innovation that you heard about all along. And the medical school cannot function without the UMP, either in its, just these mission-driven aspects and financial. Since this, since we've submitted the slide deck, there was a change on number 2, and we are now in the process of reducing physician and staff compensation in a very abrupt, as you can see, and severe way. We are still working to achieve the support from the state and from the Fairview, but to this time, we have not been really successful. So we are reducing compensation of our physician up to 20% based on income, based on specialty. And this is in addition to what we have done already, because we have taken away the retirement and the business expense account, and the cumulative hit is very significant. And there is a cruel irony in this, because the people that we are, you are, I am, when you get a fever, or stop smelling stuff, this is what you go after, right? These are the people that will take care of you and your loved ones. So the people that we are counting on the most cannot count on the stability that comes with personal validation of their effort. And I am very proud of our team. I'm very proud of our faculty that they are able to take this with a dose of equanimity and a dose of stability of mind that I hope will bridge us to where we need to go. But my concern remains, and with the president, I agree that as she said earlier, the people is the most treasured asset we have. So I remain concerned about the long-term impact of morale and on the loyalty. With this, I'll turn over to the Chief Finance Officer, Pete Midge. Pete?
Thank you, Dr. Tolar. You've seen this slide before. The numbers have changed a little bit because you saw it a couple weeks ago, and we continue to ramp up the services that are provided. As a reminder, we had estimated 6 weeks ago that the revenue that Physicians earns every week would be down about $5 million per week. And so we took some actions right away. You see reducing the retirement contributions and the business expense allowances, and voluntary salary reductions from the leadership team, which is roughly about 55 people. Over the last couple of weeks, our outpatient encounters now have bumped up to about 70% of our pre-COVID levels. We've done that by using video reviews and phone examinations. They account for roughly 55% of that total now. The hospital census this week has started to increase. It's about at 64% of its pre-COVID levels. The key figure, though, is the surgical cases, which in the last few weeks have been down at about 30% of our normal volumes. They're starting to ramp up now and will continue to ramp up over the coming weeks as the governor's restrictions have been relaxed. So that's really the key for us, is the surgical cases and the inpatient admissions that follow, because that's what drives a lot of our revenue. So we're still estimating that our revenue is down about $4 million a week. We will not offset that entire amount through the salary reductions and the retirement contribution reductions that you see here. But we will reduce the gap to a level that we can absorb because we do have some reserves in the corporation. The salary reductions that Dr. Tolar referred to are poised to take place on Monday, May 11th. For physicians, it'll range anywhere from 10% to 20%. A few might be a little more than 20%. And all the staff within UMP will take a salary reduction as well. The lower compensated people will take 10%, ramping up to the leadership, which will take 20% reductions. And that's the model we're using for the physician workforce as well. The lower compensated individuals will take 10% salary reductions, the higher compensated around the 20% level. And we continue to look for non-personnel expense reductions as we go forward. So we're going to do this for the next 5 pay periods. That takes us into the month of July. We'll revise our estimates on a weekly basis, and if our surgical volumes continue to ramp up, we should be able to at least scale back the salary reductions after 5 pay periods. Questionable whether we'll get back to our previous levels and be able to restore salaries to 100%, but that is certainly the goal. Those are the comments I had prepared.
Thank you, Pete. I'll take it from here. So as you look at this slide, please consider that the efficacy that I'm asking my clinicians, my researchers, my staff, my administrator, the efficacy that is intensified is a goodwill, good-natured maneuver. But efficacy at the cost of resilience is like a silent aneurysm waiting to rupture. There's a limit to where we can go from here. Next slide. So, okay. So I have been given, and I'm very grateful for the opportunity to serve as a chief medical officer for this university in the capacity of the campus public health officer. And even though you heard a great deal about the medical school and the UMP, this is not the whole thing. This is again the space between the burning logs. This is the fire, that the university makes possible, and that's where the Academic Clinical Affairs Office and its infrastructure with the CTSI, with the Masonic Cancer Center, with the College of Design, College of Veterinary Medicine, College of Science and Engineering. That's where it all happens. And I am very grateful to my fellow vice presidents, Crossan, Kramer, Bergerson, Burnett, and Gulacek for their help in integrating everything in diversion of some of the staff and structure to assist in the COVID-19 efforts. And that included informatics, project management, data analytics, regulatory support, telehealth, education, workforce education, and so forth. Next slide. We are also serving underserved. The Community University Healthcare Center is, and some of you, Regent Anderson, I think, Regent Simonson as well, pointed out that the underserved communities are part of our portfolio. This is why, again, we live the land-grant mission of this university and this Office of Academic Clinical Affairs. And as Cook, then College of Dentistry and College of Veterinary Medicine are all looking at the similar financial pressures as everybody else. And we remain, as some of you said, global leaders in the space, thanks to the ramifications and the robust support we get from all of these other colleges. Next slide. So the last 2 slides are simple. They are a timeline. I want to make sure that we all understand, how things happen, because it's so easy to forget, as we have forgotten, I think, including myself, what kind of a prediction we made a month ago and how different it is from reality. And forgetting these lessons, I think, is dangerous. So if you go back, the first time I heard about the COVID-19 was on the 29th of December. I remember exactly where I was. It's a little like the moon landing or 9/11, and looked at the CT scan and knew that this is going to be different. I didn't know that this is going to be pandemic, of course not, but I knew this is going to be different disease. And then we realized that, again, we are good in your eyes. We are good in your appreciation. We serve you by being prepared. And that's why the first time we actually got together with my teams to do something about COVID-19, I don't actually know whether it was actually named at that time, was on the 17th of January. We already had a team. On the 24th of January, we already deployed from the campus public health officer the first guidelines, first structure for how to actually navigate this. And that is, again, quite a bit ahead of the first case in Minnesota, which was on the 6th of March. Can you flip to the next slide? Then on the 13th of March, that's on the bottom left, that's where the peacetime emergency has been declared. And 19th of March, that's where the first death from COVID-19 in Minnesota was announced. But we were ahead, again, of the curve of the wave. We had on the 15th, that's already seen the first research rapid response grants for COVID-19. Dr. Yohe, that I mentioned to you before, has put her team together on the 17th. We opened the first COVID-19 hospital in Bethesda on the 26th. Dr. Bischoff and his Institute of Engineering and Medicine has been already putting forth the masks that you see on the top. And between the Department of Anesthesiology, the Medical Device Center, and his institute, we were already working on the ventilator that then got approved by FDA at the EUA mechanisms on the 15th. Doctors Jenkins and Karger, these are the heroes of the serology, launched it on the 14th. And that's why, this is a collective effort. That's why it's so important that we are able to take confidence not just in science but in each other, and really run in parallel the sunrise of the president in clinic, in research and education, and retain the ranking of the medical school, its research. As you probably recall from my presentations in the fall, 64% of the research at this university sits in the single college, which is the medical school. And that's how we sustain the practices. That's the UMP, the physicians, competitive edge on the work at the marketplace. And collectively, we bring you the intellectual and practical autonomy and organizational fidelity. So we are here today, and my business today is to ask for your approval of the resolution allowing for flexibility of our funds flow between the medical school and the UMP. We have taken your suggestion, Regent Beeson, to extend this time to 24 months. And it says, again, clinical revenue in medical school reserves that we will, with your guidance, use to pay for medical school expenses that the UMP has covered over the years. I'm of course, profoundly grateful, and I defer to your leadership and wisdom on what action to take, but be assured that regardless, we will follow your intent and your direction with all the loyalty, all the focus and determination that we can master. Thank you, Mr. Chair.
Thank you. Thank you, Dean Toller. Thank you very much. Mr. Steves, just as a reminder for all of the regents, will you read the resolution, the summary commentary on the resolution to remind everyone on the board of this resolution, which we reviewed at our last meeting?
Mr. Chair, the relevant action item from the resolution is, now therefore be it resolved that notwithstanding existing commitments and expectations regarding transfer of clinical revenue, the Board of Regents authorizes the president or delegate to utilize medical school clinical reserves to defer up to $5 million in UMP clinical revenue for up to 24 months from the date the transfers would have been made.
Thank you, Mr. Steves. Could I have a motion in support of the resolution?
So moved.
Is there a second?
Seconded, Mr. Chair.
It's been moved and seconded. What I'd like to do now is
So they'll turn our video on.
is move to our discussion. I know that you're all familiar with the resolution. It's as we reviewed it, and so rather than go through the entire list, I think what I'd like to do is just if anyone would like to comment, we can get that information to me. And I see that Regent Hsu would like to comment, and so Regent Hsu, if you would go first, and anyone else who has a question or a comment, let Mr. Steves know. Otherwise, that it's okay. I think we understand the resolution generally. Regent Hsu.
Thank you, Mr. Chair. I was just going to say this is a no-brainer, and I intend to support the motion. Thank you.
Mr. Steves, I see no one else. Is there anyone else who's?
I believe Regent Beeson would like to speak.
Regent Beeson.
Thank you, Mr. Chair. I obviously support the resolution. As Dr. Toller indicated, it would be a failure if we go back to normality. And I'm reminded of a recent report coming out of the COVID-19 that there's an orphan disease that is maybe triggered by the coronavirus. It's called Kawasaki's disease, and my grandson had it when he was 1 year old. I don't know if you can see the picture of him here, but he was treated at Northwestern University. And it's an orphan disease. It's a mystery disease. There isn't much research, but maybe this will be an outcome.
Yep.
Thank you.
Thank you. All right. Seeing no one else, we'll proceed to the roll call vote. Mr. Steves.
All right, Mr. Chair, on the UMP resolution, Regent Anderson.
Yes.
Regent Anderson votes yes. Regent Beeson.
Yes.
Regent Beeson votes yes. Regent Davenport.
With gratitude, yes.
Regent Davenport votes yes. Regent Her.
Yes.
Regent Her votes yes. Regent Hsu.
Yes.
Regent Hsu votes yes. Regent Kenyanya. Regent Kenyanya.
Yes.
Regent Kenyanya votes yes. Regent Mayron.
Yes.
Regent Mayron votes yes. Regent McMillan.
Yes.
Regent McMillan votes yes. Regent Rocha.
Yes.
Regent Rocha votes yes. Regent Simonson.
Yes.
Regent Simonson votes yes. Regent Swigum.
Yes.
Regent Swigum votes yes. Chair Powell.
Yes.
Chair Powell votes yes. Mr. Chair, there are 12 in favor and 0 opposed.
By a vote of 12-0, the motion passes. Dean Toller, thank you, and thanks to your team. We are so grateful for everything that you do. You guys have never worked harder, never served us so well. We're very grateful, and we look forward to hearing future updates from you. And we're also very glad to hear that we're starting to see the level of clinical activity and elective surgery start to come back. Very glad to see that. We know you'll be monitoring that, and we very much look forward to hearing from you very, very soon.
Thank you, Chair Powell. Thank you, everyone.
Okay, thank you. All right, we'll turn now to our next item, which is the preliminary impact on athletics. This item is for discussion today. I know it's an area of great interest to the board. Before we begin our discussion of this very timely topic, I want to take a moment to address individual comments made this week to certain sports media outlets regarding the future of the university and Gopher athletics. As I said earlier this week, and it bears repeating, while the board and the university are planning for a variety of scenarios for fall classes, athletics, and other events in light of the pandemic, absolutely no decisions have been made about any of these issues. I believe where we are in our decision-making process is very clear from yesterday's meeting, during which we had in-depth discussions around academic planning, our operating budget, and numerous and significant inputs and levers related to decisions that are yet to come. This board's decisions and those of University President Joan Gable will be guided by advice and counsel from the Minnesota Department of Health, Governor Tim Walz, the university's own very capable public health experts, and others. And as those decisions are made, they will be clearly communicated. So with that, let's turn to our presenters. Joining us are Athletic Director Coyle and Deputy Athletic Director McFarland. President Gable, would you like to begin?
Thank you, Chair Powell, Vice Chair Swigum, members of the board. I'd like to start by thanking Athletic Director Mark Coyle and his team for their work in general and in support of our student athletes during this crisis. A first priority when the crisis hit was to ensure the safety of all of our students, including our student athletes. After ensuring they were home or in the place they felt safest, our coaches and staff have stayed in close contact, supporting them academically and conducting wellness checks by phone and by Zoom. And from all indications, the athletics program is on pace for another impressive semester in the classroom. We're also really UMN proud when we see Gopher athletes making masks at home to support those in need, or when a record 5 Gopher football players are selected in the April NFL draft. I also very much appreciate the work of the athletics team to engage our stakeholders during this challenging time, to give us things to be excited and happy about, including re-airing Gopher athletics classics like Gopher wrestling against Iowa tonight and Gopher football's 2018 bowl game win against Georgia Tech, which airs tomorrow night. Athletic Director Mark Coyle and Deputy Director Rhonda McFarland are with us today to provide an overview of the pandemic's impact on our student athletes and on the athletics program budget, revenue, and expenses. So at this time, I would turn it over to them. Thank you, Mr. Chair.
Okay, over to you, Director Coyle.
Thank you, Chair Powell, and members of the board. We appreciate the opportunity to give you an update on the athletics program. I would also like to recognize President Gable for her leadership during these unique times. We're so grateful for the guidance and counsel she's given us daily, and we're very appreciative of her efforts to lead us through this, again, uncertain times. I'd also like to make sure I recognize and thank our 275 full-time employees who I'm so proud of and worked incredibly hard to move us forward and move us in a new direction as we deal with the new business model. So with that, when this first struck us, we immediately thought of 3 important things that we wanted to focus on. First, we wanted to focus on our student athlete experience. And when we talk about our student athlete experience, we talk about academics. As all of you know, academically, we had our highest grade point average in the fall of 2019 with a 3.3 grade point average. Every one of our teams was above a 3.1 grade point, and we wanted to immediately transition and make sure that academically we can still compete at a high level. And I'm so grateful for our academic advisors in Lindahl Academic Center, for JT Brewitt and his leadership as we made that transition very successfully and very quickly. Athletically, if you go back, and of course all of us remember our special football season where we won 11 games for the first time since 1904. We had a January 1st bowl win for the first time since 1964. We had a volleyball team compete in the Final Four. And then in the wintertime, in the spring seasons, when that season was halted by this pandemic, 9 of our teams were ranked nationally in the top 25. But athletically, we needed to immediately work with our coaches to make sure that we got our student athletes to a safe place, to a place where they felt comfortable during this pandemic. And again, we're grateful for President Gable's leadership to help us with that transition. In addition, we had to work with our athletic medicine folks to make sure we continued our rehab with those student athletes who were rehabbing injuries as a result of their athletic competition. And then finally, socially, we talked about the importance of making sure that we continue to educate and update our student athletes socially. So we still are very active with our WIL program, which is our Women's and Leadership and Learning program. We continue to have learning through our Leadership U development program and teaching leadership skills to our student athletes. And then we also work closely with Dr. Berkowitz, who trained all of our staff on the prevention of sexual misconduct as we continue that initiative from the president. So again, we continue to move forward socially. And then finally, with return to play, which is the number one question that we get almost daily, please know that we continue to work closely with President Gable, with our campus medical experts. And as you all know, Commissioner Warren put together an emerging infectious disease committee that all Big Ten institutions will follow as we look to a potential return to play for our student athletes. And finally, we rely on Joy Thomas and Dr. Nelson to guide us through that practice. Our next thing we wanted to focus on was sound fiscal management. And no doubt we recognize that we must be incredibly accurate, even though these are uncertain times. And so we're trying to be incredibly nimble with our responses. We're trying to be transparent with all of our staff, our coaches and student athletes as we work our way through this. And what we will show with you today or share with you today is a snapshot of where we're at. And please know that we work closely with, again, President Gable, with Brian Burnett, with Julie Tonneson, and we'll continue to reassess the situation as we move forward. Next slide, please. We then talked about the importance of having intentional communication with our stakeholders. And as all of you know, we have 675 student athletes. And I can tell you that I've been on at least 2 calls with our Student Athlete Advisory Committee, our SAC group. We've also had a student athlete town hall meeting. And again, we are incredibly intentional. We want to make sure they understand the impact of this. Most importantly, we want to make sure that they're all at a safe place, and we want to make sure that they finish the academic semester strong. Also, again, we've talked to our 275 full-time staff. And again, I cannot tell you how grateful I am for our staff and their hard work during these uncertain times. But we challenged our staff. We made it very clear to them that in times of crisis, you can either freeze or you can act. And I'm so humbled to see how our staff continues to act and continues to move this program forward. We've had multiple all-staff meetings, and we also have frequent updates with our unit directors and senior staff. So again, we want to make sure we continue to over-communicate and provide as much information as we can to all of them. And finally, our Golden Gopher Fund members and fans. We have had weekly Zoom meetings with our head coaches. I've done Zoom meetings with our Golden Gopher Fund members and fans. And again, we want to make sure that we communicate as much as possible. But just as important, and President Gable pointed this out in her introductory remarks, we challenged our staff that we wanted to be a place where people could go to during these uncertain times. And we created a special homepage called SkyU Home on gophersports.com. And there, fans can do puzzles around their favorite sports teams. They can listen to interviews with head coaches, with student athletes. They can watch classic Gopher games. We have podcasts where we interview coaches. I've been on that podcast. And again, we're trying to be a place where people can go to during these uncertain times. And as of last week, we've had over 40,000 people go to SkyU Home on gophersports.com. Next slide, please. Now, we've talked to this group about our revenue streams, and I just want to go over this again. I've been the athletic director at 3 different institutions, and what I've learned is no matter what institution you're at with respect to athletics, you all have pretty much the same revenue streams. And I want to go over those revenue streams quickly with you. The first revenue stream we have is our NCAA and conference distribution. The second revenue stream we have is our ticket sales. The third revenue stream we have is fundraising, which is through the Golden Gopher Fund, and that's our scholarship seeding program, and that is our capital giving that comes to our department. The next revenue stream we have is Gopher Sports Properties. And Gopher Sports Properties is our multimedia rights agreement with Learfield and Gopher Sports Properties, who sells the advertising around our venues, who sells the advertising, our radio broadcasts, our coaches shows. And finally, the fifth revenue stream is what we call miscellaneous, which is our licensing, concession, parking, and rental revenues. So again, those are our 5 major revenue streams that impact our operating budget. Next slide, please. If you recall, each year we're asked to go in front of this board to go over our operating budget. And last year, this board approved our operating budget, which is $123 million. That ranks 8th in the Big Ten Conference. And as all of you know, with our 675 student athletes, we have 25 sports programs, which ranks 4th in the Big Ten Conference. And you can see the schools starting with Ohio State at $218 million, followed by Michigan, Penn State, Wisconsin, Nebraska, Michigan State, and Iowa, who rank ahead of us with respect to their operating budgets. And I do want to point out that we implemented department-wide budget reductions in FY19 and FY20. And those budget reductions had an impact of about $2 million on our operating budget. So again, we are trying to be very mindful of our operating budgets and to be very efficient to support our programs as we moved our operation forward. With that, I'll turn it over to Rhonda McFarland, who is our Deputy Athletics Director. Rhonda?
Thank you, Mark. Chair Powell and Regents. In February, prior to the pandemic, athletics was projecting a budget surplus of about $1 million. The football team had had a very successful season with 2 sold-out home games, and ended on a high note with a victory over Auburn in the Outback Bowl. Ticket revenue for our other sports was pacing close to budget, and we were on a record pace for fundraising. For example, on the annual Give to the Max Day, the university had a record day. Of the approximately $7.4 million collected on that day, 6.3 was raised by athletics. Fast forward to April, when the Big Ten and the NCAA canceled athletic events. All types of gatherings were canceled for the remainder of the semester. We learned that revenue that was projected to be distributed for fiscal year 2020 was not going to be received. By the end of the month, we were projecting a budget shortfall of approximately $4 million for this fiscal year. Next slide, please. In addition to working on a revised fiscal year 21 budget, our department has been identifying ways to reduce spending in this fiscal year to help offset the reduction in revenue. Immediately following the cancellation of events and the shift to online classes, we instituted a spending freeze that requires purchases to be approved by a member of the department's senior staff. Our business office staff contacted all of our travel partners to cancel travel arrangements that had been made for recruiting and team travel to capture refunds and credits. As the news about returning to sporting events has continued to trend negatively, the likelihood of us being able to balance our fiscal year 20 budget has decreased. Because we learn new information every day, it is difficult to know now what our final result will be. Next slide, please. As part of the information presented at the April special board meeting, athletics was asked to project revenue losses given 3 different scenarios. Based on the information we had on April 2nd, when that information was provided, we projected the following. Scenario 1 assumed that we would learn by midsummer that we will be able to have fall and winter sports with fans in attendance. As part of the adjustments to come up with the $10 million revenue shortfall we estimated, we thought that the ticket revenue and scholarship seating donations for fall sports would likely be at least 30% less than the previous year, and that winter sports ticket revenue would be impacted by approximately 20%. Scenario 2 assumed that either there would be no fans allowed in our venues, or if we had a shortened fall season. For this scenario, we estimated no revenue for fall sports for tickets and scholarship seating, and a 50% reduction in winter sports revenue. And finally, scenario 3 assumed there were no sporting events until after December 31st, 2020. For scenario 3, we estimated no fall sport ticket, associated donation, or TV revenue, and reduced estimated tickets revenue and TV revenue for winter sports. We are not alone in this situation. There are only a handful of athletic departments that could manage a $30 million loss, and likely very few that would survive a $75 million reduction in revenue. That is the nature of the national landscape at this time. Next slide, please. Earlier in our presentation, Mark walked through the major revenue categories included in our budget. The items listed here are the significant expense categories that we can evaluate for cost savings. We are working to find ways to improve efficiencies and to reevaluate our current operations, searching for cost-saving measures that will not negatively impact our student athletes. Fixed costs that we will not be able to reduce include scholarship expense, most facility expenses, and services necessary for student athlete welfare. Next slide, please. One of the significant levers in the process toward reducing the fiscal year 21 budget will be reduced payroll expenses. We have shared with all members of our department that some sort of furlough or pay reduction is likely to be required, and that there will be no merit increases for fiscal year 21. We will align with the plans that are approved by campus administration to reduce compensation and benefit costs, and will follow the hiring freeze requirement, except to replace coaches so that we can provide necessary support to students. We previously discussed the budget cuts that we had been implemented in the past 2 years, even prior to the pandemic. Since his arrival, AD Coyle has eliminated 3 senior administration positions for a salary savings of over $400,000 annually. Next slide, please. As we have stated, the revenue shortfalls impacting our department are being felt across the country. We are using this time to thoroughly evaluate our operations to find ways to reduce costs. We are revising our sport and support units' operating budgets to reduce expenses by 10 to 15% as compared to their current year budgets. In addition, AD Coyle and I were appointed to the Big Ten Strike Force on Cost Containment established by Commissioner Warren. It is important that we are involved in this so we can learn and share best practices with our peers. I've appreciated our department staff's effort and creativity in finding new ways to reduce expenses, utilizing their networks within college athletics to seek out great ideas. Our unit has pulled together as a team to help find solutions to these significant financial challenges. Thank you, and that concludes our presentation.
Thank you, Athletic Director Coyle and Director McFarland. Before I turn it over to Regents for questions and comments and a discussion, President Gable, do you want to add any closing comments, or should we just go to the discussion?
I think we can proceed to the discussion, Chair Powell. Thank you.
All right. So for this round, we'll start with Regent Herr for questions and comments.
Yeah. Thank you, Mr. Chair. And I do have a question for our Athletic Director McCoyle. With regard to the forecast that you're projecting right now, is it just losses up to now? With regards to, no, I see it's FY 21. What does that mean for fall sports then? Is it going to be in line with enrollment of our worst case scenarios with regards to if no in-class instruction, then no sports, or some semblance of it? I'm just trying to understand.
AD Coyle, I think the question is, what is where are we at in terms of scenario planning?
Chair Powell and Regent Herr, thank you for the question. Regent Herr, we have conversations daily since March 13th. I've had conversations daily with all the athletic directors in the Big Ten Conference and Commissioner Warren. In addition, I've been able to visit with athletic directors from the Pac-12, from the SEC, Big 12, and other conferences. And I can tell you, Regent Herr, that what you see now, when Rhonda talks about our FY20 budget, again, we were forecasting to be about $1 million to the good. And then when the cancellation of the tournaments and the winter and spring championships, that's where we are looking at a budget shortfall this year. And then when we talk about fiscal year 21, which of course starts July 21st, I can tell you that we are working closely with President Gable. We're working closely with Brian Burnett and Julie Tonneson to seek guidance from them. I can tell you what I am learning in all this, and as all of us are learning daily, and Dr. Toller talked about this in his presentation, all this needs to be driven by data. And obviously the medical field with really smart people are working on this as quickly as they can. But ultimately, we're going to follow the counsel of the medical experts. We're going to follow the counsel of President Gable of what it looks like when our student athletes can return to campus. And that will obviously impact our budget in terms of FY21 and when we play and when we don't play.
Thank you. And then a follow-up with that, with regards to, because I know that right now, in terms of ranking, with regard to, because I feel my heart aches for the students who are athletes, and with regards to their potential, if they don't play, they sit out a year, they get older, and how would that impact their professional ranking? I just have a lot of concerns with regards to that. And then if students aren't playing, how does that stack up with the scholarships that they are receiving?
Director Coyle.
Chair Powell and Regent Hurd, both great questions. So our student athletes, obviously Jeremiah Carter, who oversees our athletic compliance and reports up to Doug Peterson in the Office of General Counsel. We work closely with him, and all of our student athletes, they obviously have a limit on their years that they can participate in. The NCAA has provided a season of waiver relief for student athletes. And so our student athletes can work with Jeremiah Carter and with our coaching staff if their clocks are delayed and how that will look. So we'll continue to work with our student athletes and their scholarships that they receive and keep them on aid within the NCAA legislation that we're allowed to do so. So again, know that we're very mindful of that. And if I may, Regent Hur, I would like to add, when I talk about our conversations with our SAC, which again is our Student Athlete Advisory Committee, and when we talk to our student athletes, I can share with each of the board members, you would be very, very proud of our student athletes and how they responded to this. What I've learned is our kids are incredibly adaptable, and I am so proud of their questions. I'm proud of the answers they're seeking, and we've made it very clear to them that unfortunately right now there's more questions than answers. But again, they've been very mature and they've been awesome how they've handled this. And as President Gable noted, we anticipate our kids having a great semester academically. And when we get back to the athletic competition, and again, they all want to be back yesterday. I tell you, every time I talk with them, they keep asking me, when can we come back? When can we come back? But they clearly understand that these decisions will be made by our medical people in consultation with President Gable when we can bring our kids back. But they've been very, very good, and you would all be very proud of them. And please know that we continue to support them academically, athletically, and socially during this transitional period.
All right. Thank you, Regent Hur. Regent Hsu.
Thank you, Mr. Chair. Thank you, presenters. Looks like you're coming to us from Bierman. I hope you're 6 feet apart there.
Yes, sir.
I appreciate the information you provided and all your hard work to date. I know there's going to be a lot of hard work going forward. Could you provide some more details on the scenarios on the losses, lost revenue for the various scenarios? And then also, could you speak about what would be the situation, the financial situation, if we had to forego spring competition in spring of 2021? And then obviously as part of that, there's also cost savings from not having these competitions, and I wonder what those numbers look like.
Director Coyle.
Chair Powell and Regent Hsu, thank you for the question. If I may, Chair Powell, I will give a first crack at this answer, and then I'll ask Rhonda to provide some information as well. But as we shared with you, Regent Hsu, the revenue buckets. So when we talk about the 10, the 30, and the $75 million scenario. So obviously the 10 million is Rhonda pointed out is the reduction in ticket revenue for football, for volleyball, and for some of our winter sports that occur in the fall semester. And then when you go to that $30 million scenario, Regent Hsu, that would be competitions. Again, when we were asked to provide this information back in April, that was a snapshot at that time, and at that moment, there was conversations about potentially playing games without fans. And so that would not include any of that ticket revenue for those sports, and obviously a deeper impact on our winter sports, being the basketball programs and the hockey programs, et cetera. And then when you go to the $75 million scenario, when we talk about that scenario, sir, that focuses on the TV revenue, because obviously if you're not having football games on TV, that potentially impacts the TV revenue side of it. So those are how the different scenarios were laid out. And I'm going to defer to Rhonda with respect to the cost savings, because you are correct, Regent Hsu, when we don't have events, there are some cost savings that we can look at.
Regent Hsu and Regents, when you talk about savings in fiscal year 20, as you can imagine, there was a lot of events we didn't attend, a lot of events we didn't hold, and then there was some recruiting that did not happen. So the largest portion of our savings is in travel and some recruiting, and then some of our events we lose revenue, but we also don't have to incur the expense. So we've built that into our models that we are putting together for fiscal year 20. even with the savings, we don't anticipate that we will be able to balance the budget given the large revenue losses that we had to deal with. Your second question about sports not happening in the spring. At this point in time, we're following the model that campus put together with those 3 scenarios. And so we've been building our models based on that. We haven't really reached out into looking at the spring yet as if we weren't going to have events. So that's something we will do as we continue to work through our fiscal year 21 budget, but is not done at this time. Thank you.
Thank you, Deputy Director McFarland. Regent Hsu, any follow-up?
Yes, along those same lines, Mr. Chair, thank you. In terms of the Big Ten, obviously, we have had some disruption with some of the sports in the spring, and then I'm not sure what the contracts state and whether or not they're insured properly for payments, distributions that we would receive from those events and those seasons. And then also on March Madness, for example, that distribution was, I think you said we were shorted $4 million in that lost in the NCAA distribution. What actually did we get from the NCAA? Because that number is not really shown anywhere.
Director Coyle, or do you want to take a shot at that or hand off to the Deputy Director?
I'll have Ron answer that question, sir.
Deputy Director McFarland, please.
Regent Hsu, we received about a third of what we had budgeted from the NCAA because of the loss due to not holding March Madness.
Okay.
Sure.
Yeah, one more.
Well, I want to go back and get an answer for a question I already asked, which is about the Big Ten.
Director Coyle or Deputy Director McFarland?
Chair Powell and Regent Hsu, with respect to the Big Ten, as I shared with you, we are in constant conversations almost daily with Commissioner Warren and our fellow athletic directors, and we continue to get our arms around the impact with the cancellation of events. As you know, and it's talked about publicly, football drives a big portion of those media dollars, as well as men's basketball. And the Big Ten Network obviously broadcast the men's basketball tournament. They were able to get 2 games. I think they have a total of 10 games, and then the finals go to CBS, the semifinals and finals. So we're still working with the conference on what those final revenue numbers will look like towards the end of this fiscal year FY20.
Okay.
Thank you.
Thank you. Let's move on to Regent Kenyana.
Thank you very much, Mr. Chair. Director Coyle, AD McFarland, thank you for the presentation and all the information. Certainly understand you're operating with a high degree of uncertainty as everyone else is, so we appreciate that you were able to share what you were able to. I think this is all helpful. I'm really pleased to hear, Director Coyle, we know how much you value academics, and it's always the first thing you talk about, so we're happy to hear that even in the midst of this, that that's not getting lost in terms of our student athletes, that our students first, obviously, and that they're still on track to perform well there. I do have a question on the page 10 of the presentation was talking about salary reductions in alignment with the rest of campus. Do some of the employees within athletics, more specifically maybe the coaches and whatnot that have contracts that are negotiated, are those also subject to salary reductions, or is there something contractually that would limit our ability to realize savings there?
AD Coyle.
Chair Powell and Regent Kenyana, with respect to your question, obviously we work closely with the Office of General Counsel, and as all of you know, we bring several of our coaches' contracts in front of this board, so we're grateful for your work and guidance as we put those agreements together and we receive approval from you. But again, as we work closely with campus on those, it is our understanding that we could work with our coaches to have salary reductions based on the language in their contracts. And as Deputy Athletics Director McFarland discussed in her portion of the presentation, we've been very open and honest, not only with our coaches and our assistant coaches, but with all of our staff. And we've made it very clear that there's going to be some sort of salary reduction, potential furloughs. And again, we'll work closely with President Gable, with Brian Burnett and Julie Thompson on those plans. But again, it's our understanding that they would fall under those same parameters.
That's very helpful, Director. Mr. Chair, I would just say this is all helpful, and that does answer my question. And at some point, I'd love to get the same information regarding to the other 3 campuses that do have athletic programs. Thank you,
Okay, I think that's why don't we leave that as a question that's been posed, and we can gather that data for you and come back with it.
Right, not for Director Coyle, obviously.
Right.
Just wanted to put it out there.
Yep. Thank you, Regent Kenyatta. Regent Mayron.
Yes, thank you very much, Chair Powell, Director Coyle, and Deputy Director McFarland. As you look at operationally how to address this, thinking about the different sports, I take it it's not an all or nothing equation, meaning all sports proceeds or no sports proceed, but rather that you are taking a look at each sport and whether that particular sport could proceed under some sort of scenario or even in a modified scenario. That's my first question. Or is it an all or nothing proposition? No sports proceeds or all sports do proceed. And then the second question is, I understand the role the NCAA plays and the impact it has on our sports, other university sports as well. But is the decision being driven by the NCAA, or does each university, each college member of the Big Ten ultimately make their own decision as to each sport as to whether they're going to proceed or proceed fully or in some sort of modified format? So how is the decision getting made of NCAA versus each university, in particular the University of Minnesota?
Thank you, Regent Mayron. Over to you, Director Coyle.
Chair Powell, Regent Mayron, with respect to the all or nothing model, how we typically look at things, and I clearly understand this is not a typical time period, but we break them down by the fall sports, the winter sports, and then the spring sports. And I can tell you that there has not been any conversations about an all or nothing model. Again, I want to reiterate, we will work closely with President Gable and the medical experts who will drive those decisions, and when we can bring student athletes back and when we can't bring student athletes back. So again, right now, our focus, to be very honest with you, is on the fall. And we have a men's and women's cross country, we have a women's soccer program, we have a volleyball program, and we have a football program that we're focused on. And obviously football generates much of the publicity, much of the revenue. So that's why you hear a lot of talk nationally about football and when can football return. But please know we're focused on all of our sports returning. And again, we'll follow the guidance of President Gable and the medical professionals who will help guide those decisions. And then with respect to the NCAA has a governance structure. And so there's a board, the Division I or the NCAA board, which is made up of different presidents and members of the NCAA that report back up to the NCAA. And so the Big Ten has a voice. And so when I'm on conference calls each day with the athletic directors across the Big Ten Conference and with Commissioner Warren, we can obviously talk about the Big Ten, et cetera. But we need the NCAA's overall involvement because they help set the guidelines or the guardrails, if you will, so how we can all operate to make sure it's fair from a recruiting standpoint, from a competitive standpoint, et cetera. So we all work closely within our conference, but then we communicate that up through the NCAA through our representatives. And Gary Barta, who's the athletic director at Iowa, is our representative from the D1 Council from the Big Ten Conference.
Thank you, Director Coyle. Regent Mayron, follow up, or does that answer it for you?
That answers it for me. Thank you very much.
All right, thank you. Regent McMillan.
I'll pass.
All right, Regent McMillan will pass. Regent Rocha.
Thank you, Mr. Chair. One question. I think when you were going through the data, Director Coyle, if I understand, we're 8th in revenue and 4th in number of sports. Do those relative positions have an impact on our ability to address some of these concerns in the immediate term, and how does it impact us going forward?
Director Coyle.
Chair Powell and Regent Rocha, thank you for the question, and I especially appreciate the Tyler Johnson touchdown photo behind you against Penn State. So thank you for that plug. With respect to your question, yeah, again, I want to make sure I'm very clear. So when we talk about our operating budget, again, which this board approves each year, thankfully, we're at $123 million. So that puts us 8th in the conference. And as you pointed out, Regent Rocha, we offer the 4th number of sports. And so as we move forward through this pandemic, as we talk about, we need to look at all elements for our budget and how we support our programs and how we move forward. And again, that's something that we'll continue to reevaluate and reassess as we continue to advance through this pandemic and hopefully see light at the end of the tunnel in the near future.
Thank you. Regent Rocha?
Thank you, Mr.
Okay, good. Thank you. Regent Simonson.
Thank you, Chair Powell. Thank you, Director Coyle. Regent Myron asked what I was going to ask, but beyond that, you know, we have the 25 programs that we have right now. But I see sports, university sports, not just as about the money, the more inclusive environment, part of the educational experience. So I appreciate all you're doing there, but I do have one question. It's probably not a big deal. What was presented to us was the athletic program on the Twin Cities campus. We've talked about other programs about collaboratives across campuses. Any opportunities there to save money?
Director Coyle.
Chair Powell and Regent Simonson, to make sure I understand your question, sir, are you asking if there's an opportunity for collaboration between us and the other athletic programs within the Big Ten or within the Minnesota system?
Within the Minnesota system.
Thank you, Regent Simonson. You know, obviously, we're the only Division I program in the state. Obviously, Duluth has the men's and women's hockey program under Division I. I have a very good relationship with Josh Burrell, the athletics director up at Duluth. And in fact, I had an opportunity to spend a day with their athletic department, I think in my first year here, a year and a half here. And Josh and I do have conversations, but I do appreciate the suggestion and can have further conversations with Josh to see how we may look at potentially collaborating together to see if there are ways that we can have better cost containment with our programs.
Well, I'm even thinking administrative stuff. So even though there are different divisions across the campuses, administratively, equipment, other stuff like that. It's probably not a big deal, so we'll move on.
Okay.
All right. Regent Simonson, thank you. Regent Swigum.
Mr. Chairman, thank you. I firmly believe that Director Coyle does things the right way all the time. So I have no questions, but I appreciate the financial update.
Thank you, Regent Swigum. Regent Anderson.
Thank you, Chair Paul. I'll be brief. I don't have a question. I have a comment, and it's somewhat on competition. Just like we talked yesterday about enrollment and students and parents want to get back to a normalcy this fall, I am advocating that we go slow. Athletic Director Coyle, with your work with your other athletic directors in the Big Ten and the NCAA, I would suggest being very, very deliberate in making your decisions. Regent Beeson had a great comment yesterday about let's not, and athletics are a little different because you have to have competitors to play, but he made the comment, let's not be pressured by our peers into making our decision. Let's be deliberate, look at what is out there, what is coming down the pike. And I would just caution you that way. I think we have some good ideas of what we may be able to do, and you can work with your colleagues. Once we see Major League Baseball and how they're doing things, they're going to have to do things before us in the fall. And so speaking as a fan and representing all those fans out there, I just want you to take your time on as we move forward into the fall, and hopefully we can science will let us move forward. So you can comment on that if you want. Otherwise, it's just my comments.
Thank you, Regent Anderson. Director Coyle, would you like to respond?
Chair Powell and Regent Anderson, completely understand and respect and appreciate your comments. And again, I don't mean to repeat myself. We all want to make the best long-term decisions. And unfortunately, there's more questions than answers. And I joke that patience is a 4-letter word sometimes, but I hear you and understand you. And please know that, again, I can't tell you how grateful we are for President Gable's leadership. She has been incredibly deliberate and thoughtful and that has rubbed off on me and our department, and we will make sure that we continue to be very deliberate and very thoughtful in our decisions. And again, we do what is best and the most safe for our student athletes, fans, and people who come back to our campus community. So thank you for those comments.
Thank you. Thank you, Director Coyle. Regent Beeson.
Thank you, Mr. Chair. Thank you, Athletic Director Coyle and Deputy Director McFarland. Athletics does some of the most transformative work and impactful work with our students and with the public as it relates to our brand, but it also more resembles a business than almost any unit that we have. And because of that, they're suffering. They have the risk of suffering more than any unit around the university. Like a lot of businesses right now, they need a bridge. They need support in non-traditional ways. I foresee that we may need to provide that bridge, to provide the time that athletics needs to get this thing sorted out. I'm completely confident in the department's ability, coupled with in this case, the peers add value, and through the conference, I think there'll be best practices. And this is an industry that's changing quickly, but I don't think it means that it's fundamentally broken. I mean, demand and revenue has been at an all-time high, and that may be adjusted down for some period of time, but this is a business that we've been in for 140 years, and we'll be in the business for a long time going forward.
Thank you, Regent Beeson. Director Coyle, any comments or reaction to Regent Beeson's thoughts?
Chair Powell and Regent Beeson, thank you for your comments. And obviously, as I shared at the beginning, we're just so grateful for your support and the board's support, and agree with your comments that there's no doubt we're going through uncertainty, but there is no doubt in my mind we will be back. And we'll be back when data allows us to come back, and we'll all be back. As you know, sports connects people, it unites people, and we're very proud of our role on this campus and grateful to be the front porch of this institution in a lot of ways. So I appreciate your comments, sir.
Thank you. Regent Davenport.
Thank you, Mr. Chair, and thank you, AD Coyle, and to you and your team for putting students first, and also for keeping our fans engaged. So with that, I have no further questions. Thank you.
All right. Mr. Steves, I don't see anyone else with a wish to comment. Do you concur from your end of the text messaging?
Mr. Chair, I agree. There are no other speakers at this time.
All right. Well, look, I don't have any additional comments other than Director Coyle to thank you for your really terrific leadership, and Athletic Director McFarland, thank you for laying out and sharing some of the numbers with us today. We appreciate it. Know you're working hard. We look forward to updates from you in the future, and thanks for this time today. All right. So now we'll turn to our committee business. We had the opportunity to discuss each of the action items in committee meetings yesterday, so I'm not going to call on each regent for discussion for votes on committee recommendations. If you are interested in asking a question or making a comment or asking for an item to be separated out, please use the raise hand feature or alert the staff. We'll begin with a report of the Audit and Compliance Committee, and Regent Rocha, it's over to you.
Thank you, Mr. Chair. The Audit and Compliance Committee did not consider any action items this month. In our meeting yesterday, we spent our time discussing the impacts that the COVID-19 pandemic has had on the university's internal audit, compliance, and internal control functions. The committee was pleased to hear from several senior leaders, including Chief Auditor Klatt, Chief Compliance Officer Coomer, Associate Vice President Volna, and Controller Paulson. They all reassured us that although the university is operating under reduced operations, their work continues. They also reported no significant compliance or internal control issues because of changes to university operations. Thank you, Chair Powell. That concludes my report.
Thank you, Regent Rocha. For the Mission Fulfillment Committee, Regent Anderson, please.
Okay, thank you. The Mission Fulfillment Committee acted on 2 action items this month. First, the committee voted unanimously to recommend approval of the annual promotion and tenure recommendations, including the promotion and/or tenure of regular faculty, the promotion in rank of contract faculty, and the continuous appointment and promotion of academic professional candidates, as presented by Provost Croson outlined in the docket. I I move approval of these promotion, tenure, and continuous appointment recommendations.
Thank you, Regent Anderson. We had an opportunity to discuss this yesterday, but are there any other additional questions or comments on the motion to approve promotion of tenure and regular faculty? Seeing none, Mr. Steves will call the roll.
On the promotion and tenure recommendations, Regent Anderson.
Yes.
Regent Anderson votes yes. Regent Beeson.
Yes.
Regent Beeson votes yes. Regent Davenport.
Yes.
Regent Davenport votes yes. Regent Herr.
Yes.
Regent Herr votes yes. Regent Hsu.
Yes.
Regent Hsu votes yes. Regent Kenyanya.
Yes.
Regent Kenyanya votes yes. Regent Mayron.
Yes.
Regent Mayron votes yes. Regent McMillan.
Yes.
Regent McMillan votes yes. Regent Rocha.
Yes.
Regent Rocha votes yes. Regent Simonson.
Yes.
Regent Simonson votes yes. Regent Swigum.
Yes.
Regent Swigum votes yes. Regent Powell.
Yes.
Chair Powell votes yes. Mr. Chair, there are 12 in favor and 0 opposed.
All right, that motion is approved by a vote of 12-0. Regent Anderson, any other business from the Mission Fulfillment Committee?
I just want to say congratulations to our promoted newly tenured faculty and those academic professionals who received continuous appointments. The committee did also vote unanimously to recommend approval of the consent report, which includes approval of new, changed, and discontinued academic programs. I move approval of the consent report.
Thank you, Regent Anderson. And I don't see any additional questions, so we'll move to the vote, and Mr. Steves will call the roll.
On the mission fulfillment consent report, Regent Anderson.
Yes.
Regent Anderson votes yes. Regent Beeson.
Yes.
Regent Beeson votes yes. Regent Davenport.
Yes.
Regent Davenport votes yes. Regent Herr.
Yes.
Regent Herr votes yes. Regent Hsu.
Yes.
Regent Hsu votes yes. Regent Kenyanya.
Yes.
Regent Kenyanya votes yes. Regent Mayron.
Yes.
Regent Mayron votes yes. Regent McMillan.
Yes.
Regent McMillan votes yes. Regent Rocha.
Yes.
Regent Rocha votes yes. Regent Simonson.
Yes.
Regent Simonson votes yes. Regent Swigum.
Yes.
Regent Swigum votes yes. Chair Powell.
Yes.
Chair Powell votes yes. Mr. Chair, there are 12 in favor and 0 against.
Oh, thank you, Mr. Steves. So by a vote of 12-0, that motion is approved. Regent Anderson, any additional committee business?
No, there's not, Chair Powell. That concludes my report.
Thank you. Regent McMillan, will you please share the report of the Finance and Operations Committee?
I will indeed, Chair Powell, and having met for 4 hours, it may come as a surprise that we only had one action item yesterday. We did discuss a great deal, and I won't review all that since it was less than 12 hours ago. We are not much longer than that we did it. But the Finance and Operations Committee acted on the revised consent report, and the committee separated one item from the report. I will move the rest of the report first and then address the item that was separated out, the principles for allocating federal CARES Act funds for student assistance. The committee voted unanimously to recommend approval of the remaining items in the revised consent report, which includes the Central Reserve's contingency, purchase of goods and services over $1 million, amendments to the retirement plan, course fees, refunds for spring 2020, and 2 schematic designs. And with that, I move approval of the revised consent report minus the one item I noted.
Thank you. Are there any additional questions on the consent report without the principles for allocating federal CARES Act funds? Any questions on that part of the report? Don't see any questions. So with seeing no questions, we'll call for a roll for the vote on that portion of the consent. Mr. Steves.
All right, Mr. Chair, on the Finance and Operations consent report, Regent Anderson.
Yes.
Regent Anderson votes yes. Regent Beeson.
Yes.
Regent Beeson votes yes. Regent Davenport.
Yes.
Regent Davenport votes yes. Regent Herr.
Yes.
Regent Herr votes yes. Regent Hsu.
Yes.
Regent Hsu votes yes. Regent Kenyanya.
Yes.
Regent Kenyanya votes yes. Regent Mayron.
Yes.
Regent Mayron votes yes. Regent McMillan.
Yes.
Regent McMillan votes yes. Regent Rocha.
Yes.
Regent Rocha votes yes. Regent Simonson.
Yes.
Regent Simonson votes yes. Regent Swigum.
Yes.
Regent Swigum votes yes. Chair Powell.
Yes.
Chair Powell votes yes. Mr. Chair, there are 12 in favor and 0 opposed.
Thank you, Mr. Steve. So 12-0, that motion is approved. I think we'll move now to the CARES Act funds, the principles for allocating federal CARES Acts. That's been returned by the committee without a voter recommendation. What I'd like to do now is seek a motion to approve that principle. We'll then go on to a discussion. Is there a motion to approve?
There is a clear.
I will move that.
Is there a second?
Second.
Thank you. So to address the questions that were raised yesterday in the Finance and Operations Committee and give the board additional information mentioned during the discussions, I'm going to ask President Gable and Senior Vice President Burnett to walk us through the relevant points on the CARES Act and principles we will be acting on before we begin our discussion. During their presentation, if you want to speak to the motion, use your raise hand feature or send a request to Jason Langworthy. With that, I'll turn it over to you, President Gable.
Thank you, Chair Powell. So just as a reminder, the CARES Act is federal stimulus funding. Our estimated portion of that overall for the institution is somewhere between 35 and 36 million. And as per the statutory and agency guidance, half of those funds are intended to be distributed directly to students. The methodology we have for distributing funds to students in the form of financial aid or other philanthropic support is not entirely helpful given the unique nature in which we are receiving these funds. And so we have to apply some of our existing methodologies tailored to the unique circumstances of the times we find ourselves in terms of student need and the guiding principles that have been provided both by the federal government legislatively and by the Department of Education in how these funds are to be distributed. And so we're trying to strike a balance between our desire to pull these funds down, so to speak, and then distribute them to the students, rely on some of our internal existing operational excellence, some of the delegated authority that the Office of the President has, and the fact that this is a sizable amount of money, well above the $1 million threshold, and one which has received a fair bit of national conversation, to make sure that the board was comfortable with the principles that we developed that reflect our awareness of the guiding principles that have come from the federal government statutorily and from the Department of Education and from the advocacy and needs that our students have expressed in general and in their efforts to receive emergency funding. With that, I would turn it over to Senior Vice President Burnett, who can talk about some of the specifics and how we're striking our balance in that guidance in our efforts to come up with a plan.
Okay, thank you. Thank you, President Gable. Senior Vice President Burnett.
Thank you, Mr. Chair and members of the board. Good afternoon. In your revised consent report that begins in the docket on pages 225 and 226, we list for you the principles that our campuses and provost have worked across our system to put together to kind of strike how we would approach distributing these limited funds in the spirit and the guidance, as President Gable noted, that we've received from the U.S. Department of Education. And I won't read those to you, but I will say that these principles are consistent with their compliance requirements. And these are one time, these are not continuing. So these are, as President Gable noted, these are stimulus, these are one-time funds, but there is an expectation, I would say, that we get these moving and in the hands of students who were negatively impacted by the COVID-19 pandemic. I'm happy to take any questions you may have. I know that you've been briefed about some of the expectations about how the university acts as an employer with their regard. And I would say on behalf of the president and the senior leadership team, we believe we have a good approach to that mitigates many of the concerns that might be raised. And we recommend approval of this today so that we can begin distributing these funds to students.
Thank you, Senior Vice President Burnett. So I think what I'll do now is open it up for discussion and questions. And let me just see where we're at. It looks like Regent Shu would like to ask a question. Regent Shu.
Yes, thank you, Mr. Chair. I guess my question, I don't know who it's directed to, but I was under the impression that we were going to get some more information about this after the meeting yesterday, and I don't think I received anything, so was wondering what that was all about.
President Gable or Senior Vice President Burnett.
Thank you, Chair Powell. Regent Shu, my understanding is that the information that you wanted was in the form of discussion. If there are specific, more robust discussion, if there are specific details you're seeking, then we misunderstood.
Mr. Chair?
Yes, Regent Shu.
Thank you, Madam President. Well, I guess I was kind of looking for some kind of in addition to the principles, I understand that funds must go only to FAFSA eligible students, but is there some kind of formula? I mean, all I'm looking for maybe is the word proportionally, so that not, maybe you're, maybe it's hard to understand what I'm asking, but basically if a student is FAFSA eligible, they're obviously people that are getting very little money and people getting a lot of money. And I just want to make sure that whatever we're going to give out to them from the CARES money is proportional. I don't see that word in the docket anywhere. So is there a formula based on?
Yep, President Gable, you can take a shot at that, or if you want to hand that to Senior Vice President Burnett.
I'll start, and then if there's additional supplementation. There is no formula. I want to clarify one thing, though. There's FAFSA eligible refers to your citizenship status, not to your financial need. Anyone can file a FAFSA regardless of their personal wealth. So every student we have who isn't specifically excluded is FAFSA eligible. Having need is a separate consideration, and the principles reflect that the greater the need, the more we would intend to distribute. And what we're determining now is a way in which to do that fairly, given that many of our students' needs changed precipitously in the last few months in ways that would not be captured by a FAFSA. So FAFSA eligibility is a question of eligibility. It is not necessarily an accurate description of need, and we're looking for how to strike that balance, and that's what's captured in the principles that we've prepared.
Mr. Chair?
Yes, go ahead, Regent Shu.
Yeah, I'm a little troubled by that explanation because FAFSA eligible, I mean, anybody can apply for FAFSA if they're a U.S. taxpayer. So I'm not sure how we're going to make a determination of what need is if they didn't fill out a FAFSA application or whatever it is form prior to the beginning of last year. And I also have that also begs the question of what is going to happen to people who have graduated or do not come back to the university after this spring semester.
Yeah, so President Gable, maybe you can answer the question on sort of data and process that will be involved, and also recent graduates.
Thank you, Mr. Chair. Regent Shu, being FAFSA eligible doesn't mean you have need. That's my only point. There is FAFSA eligible refers to whether you are allowed to file one. What you put in the FAFSA indicates your level of need. So the Department of Education guidance that indicates who is eligible or who is not can be clarified with a FAFSA. People can retroactively file FAFSAs. We also have a special circumstances category in financial aid for people who require financial aid suddenly. It doesn't anticipate exactly the circumstances of the pandemic. And there's nothing about that that precludes us from including students who were students in the spring semester, whether they are graduating or not. So the clarification, FAFSA eligible does not mean that you have need. They are two totally separate considerations.
President Gable, can you comment on the data and the process that we will use to establish need?
We're going through that process now, that we would develop a formula based on the board's approval of the principles. So that's the part that we would expect governance to surround, and then the principles to help us figure out how operationally we would figure out the distribution.
Okay, thank you.
Mr. Chair.
Yeah, one more.
One more. Thank you. I guess I'm a little bit concerned that we don't really know what we're doing here. And also, there was a question raised yesterday about whether or not we want to take this money at all. And I'm not saying we shouldn't, but I'm saying we should understand what we're getting ourselves into, because this isn't, it's a lot of money, but it's not a lot of money. And if this, if taking this forces us to maintain full employment, I'm not sure what that really means, because obviously if we're only going to get $18 million to support, keeping everybody on, how long do we have to keep them on for? Do we just have to spend the 18 million and show that we spent the 18 million, or what are we actually committing to here?
President Gable, do you want to take that or get additional help in answering that question?
I'm going to take option C and do both A and B. So we are in the process of developing the plan. We weren't going to proceed with the plan unless the board approved the principles upon which we would develop that plan. That is the step we are in right now. There's no point in developing a plan if the board doesn't approve the guiding principles. And that is our understanding of the role of the board in this case, would be to approve the guiding principles, and then the distribution itself is part of our financial aid delegated authority. That is why we've broken it into the steps, which we could then report back on in June, assuming the board had approved the principles in the first place. With regard to the risk and what is expected in the guidance we've received from the federal government in terms of employment, for that, yes, I will defer to General Counsel Doug Peterson.
General Counsel Peterson, can you comment for us on the government's expectation on employment related to the CARES grants?
Yes, Chair Powell, thank you. Good afternoon, everyone. I probably need a little bit of time to set the table for this sort of important question concerning the proviso, if you will, that's a string attached to the receipt of the money. Just to be clear, the proviso we're talking about would require each campus to certify that, and I quote, has continued to pay all of its employees and contractors during the period of any disruptions or closures to the greatest extent practicable, end of quotation. So as a textual matter, there's clearly ambiguity in terms of what continue to pay means. There's ambiguity and judgment involved in the to the greatest extent practicable standard, and there's uncertainty in terms of the length of time, that is, continuing it for during the period of any disruptions or closures. And so, Regent Chu and members of the board, with that ambiguity certainly comes legal uncertainty. With legal uncertainty comes risk. I can't provide you any safe harbors given the undefined nature of the statute. There's no sort of lawyer's good housekeeping seal that can be applied for any particular way of sort of addressing the various budget levers that you will want to employ as a result of this particular pandemic. All of that said, I think there is sort of another perspective that I might be able to provide you. And as I wade into this, know that I appreciate that this is as much sort of public policy as it is legal advice. But I think you should keep in mind that this CARES Act is also an opportunity for this university to endorse our values. And what I mean by that is we're a public university. We have a mission of service. And so what this statute also presents is an opportunity for this university to be a conduit of federal money to aid students. And maybe another way to put that is I do think you should consider what it would mean for this public university to say no to that money. And I'm not suggesting that you shouldn't say no, or, it's more, I think you also need to contemplate kind of what that path would mean. And in the end, this CARES Act is requiring that each of you in your governance capacity are pledging that you are going to make budget decisions that will in effect show you care for students, employees, and contractors. And I think what this sort of germ is teaching us is that people are counting on the resources and resilience of large institutions. This statute is counting on this institution to use its resources to keep people employed to the greatest extent practicable. And that's for their sake as well as for the sake of the economy. And so I think your decision making has to keep that spirit in mind. Now, what does that mean in practice? And there may be three sets of comments there. The first, with regard to any tool or lever that you wish to employ in a budget context, I think it's fair to say that you should view this statute as a yellow light and not a red light as to any particular remedy. This statute is in some ways instructing you that you as a Board of Regents are in the best position to judge this. You oversee this university. You are in the best place to gauge its, quote, unique financial circumstances, unquote. You, by taking this money, are pledging that you're going to exercise your fiduciary oversight in a way that takes care with our employees. Good faith, if you will, is in the first instance in your hands to define. And I think the federal government is counting on you to do right by your employees. Second set of comments, sort of in terms of substantive choices or action steps. And I use this to sort of highlight what I see as the university's good faith already shaping up vis-a-vis this CARES Act proviso. And I reference things that have already taken place, as well as some of the plans that President Gable and Senior Vice President Burnett reviewed yesterday. A few examples. This university is keeping employees on the payroll through the end of this semester. As to university-wide remedies, I heard yesterday administration talking about furloughs as opposed to wholesale terminations. Third, Vice President Burnett was talking about using the university's reserves to shoulder some of the financial burden here. And finally, when it came to contractors, there was conversation about how, with the legislature's help, we would be trying to keep most of our construction projects moving. I mean, to me, those are the building blocks of what I would call as sort of genuine good faith in terms of honoring this commitment, as ambiguous as it may be. Final sort of set of thoughts for you is that on a going forward basis, what's embedded in this statute are two other things. One is the university is going to be required to prove its case. It's not only a matter of you exercising sort of your judgment in somewhat flexible territory, but you're going to have to be prepared to prove it, and prove it in detail is what this statute is going to require. There's reporting obligations that are triggered as early as 30 days from when we start to receive the money. Our use of the money is going to be subject to audit. And so I think come June, if you decide today to go forward in accepting this money, by June, you certainly should expect from administration so the type of in detail analysis that kind of backs their budget recommendations that will serve you just as a matter of your usual policy, as well as serve you for CARES Act compliance purposes. And then another aspect of it is timing. You know, in the natural, in terms of sort of honoring the good faith expected of Regents, the fiduciary responsibilities, you know, you should keep in mind the timing of how you may exercise different levers or tools. You know, as a general matter, you know, I think the question would be, did you try modest steps before you turn to drastic action? And that means you need to prove as well that you've been sort of judicious with how you employ your remedies over the course of time. And of course, the time again is uncertain because none of us are sure of the time period of the disruption that is going to be tied to COVID-19. So Regent Hsu, Chair Powell, that's probably a little more than you were anticipating here, but I think it's good that I try to set that table for you so that you know, the conversation can have maybe a little broader policy as well as legal foundation for your views on whether or not to go forward and accept this money.
Yes, that was very detailed, but I think very, very helpful, General Counsel. So thank you. I see Regent McMillan would like to comment.
Thank you, Chair Powell, and thank you, President Gable and General Counsel Peterson for the framing of this. Having chaired yesterday's meeting, I want to start with just one procedural point because Regent Hsu asked about was there any additional information expected, and I think the one piece that perhaps still needs an answer is what about graduating seniors, and I may have said I'm sure that the administration can get us more info on that, but in the middle of that conversation that might have got lost. So probably President Gable should just make sure that's clear. That was the only thing I think that there was a commitment to, or I made a commitment for you to come back to. And it's my understanding that the statute focuses on students in need and what that need is, and doesn't limit them. But I'm not the expert. So here's my thoughts on this, Chair Powell. I think that as a public institution of higher learning, that we probably have a bit of a duty here to do everything we can to help our students and help Congress carry out the intent of this, which was to help students in financial peril as a result of, or financial distress as a result of this pandemic. And that leads me to the first thought. I think we need to accept this money, certainly the half that goes to students. And I also think that we have, as I think about the risks, and General Counsel Peterson framed them nicely, I think that we have been extremely thoughtful and extremely judicious and erred in favor of our employees to date, and employing everybody, whether they have regular day-to-day duties or not, including student employees, from the start. And that commitment, I think, carries through on an ongoing basis, at least until the end of this semester for the bulk of our employees. So when I think about that requirement, and I think about our application of that obligation, I feel pretty good about the fact that when it comes time to, as General Counsel Peterson said, prove our case, that's our starting point. Now, the ambiguity is if it's October of next year and things are still ugly, it doesn't seem to me to be a reasonable expectation for $18 million, which is the organization's piece of this, that we'd have a never-ending obligation to employ everybody in the system, whether they have anything to do or not. So I think that you have to take some rational and reasonable, interpretive liberty here, and that's where I land. I just can't really see myself as a regent saying no to money designed and intended to help students in peril, and frankly to help a university with a significant fiscal challenge in front of it that the other 18 million would be put to work doing. It feels to me like we should accept this. And here's my last piece. I am fully comfortable as a regent to approve the principles and then have our administration delegate what is essentially a unique type, or at least a subclass of financial aid. They regularly administer $300 million in financial aid, and we do so with principles and programs and policies that don't get us into the details of who gets what. So I am perfectly comfortable if we want to approve these principles with then stepping back, and they will administer the 18 million as part of what I just said, probably north of $300 million annual financial package. So that's my thought. But back to where I started, I do think that a clarification about graduating seniors would be helpful for the board.
Thank you for that. Those comments, Regent McMillan. Thank you. And before I move on to our next person, or next regent, President Gable, can you just quickly clarify the graduating senior point? I thought we had answered that, but would you give us some clarification there?
Yes, thank you, Chair Powell. Graduating seniors should be eligible. We don't see anything in the guidance that precludes them.
Okay, thank you. I'm going to move on now to Regent Rocha.
Thank you, Mr. Chair. I signaled in prior to the commentary by General Counsel Peterson, and he really, I think, very effectively walked through my thoughts on it. I appreciate both the legal interpretation and then also his additional perspective. I thought that was very helpful. And then I would also incorporate then what Regent McMillan was just saying. Here's my take very quickly. I agree with General Counsel's assessment about the ambiguity. I see the continue to pay as being reflective of those that have provided work that we are going to pay them as appropriate. And I also agree that the word practicable means something. It's there for a reason. And that clearly would indicate that we are in the position to judge what we are able to do going forward. And so I do think as a public institution, just as Regent McMillan stated, I think that it would be a tremendous message if we did not accept it. And I think it's an appropriate message that we do to provide the support to our community. I'm talking about both portions of the CARES Act money. I just want to make sure that it's clear that I'm supporting this not as any sort of a surrendering of the authority to make those critical decisions if things go in a different way or continue to be difficult, that we will still exercise the ability to do that, and that our decisions to continue to maintain the largest workforce possible and so on, as was described, is based on our belief it's the right thing to do, not because we have surrendered that ability to make those decisions going forward. So I am comfortable with the administrative position, just as Regent McMillan described. We do this all the time in delegating the process of making these distributions. Obviously, we continue to oversee that over time, and would expect that some sort of report would be provided. But other than that, I think that this is an important opportunity. There are institutions, as we know, that have turned this down. I believe that they tend to be private institutions that are concerned about public pressure on their endowments. And as a public institution, I don't know that we face that same type of pressure. And so I'm very comfortable with where we are at this point. And I respect Regent Chu's questions. I just, at least at this point, I'm comfortable that we have the information needed to move forward. Thank you.
Thank you, Regent Rocha. Thank you. Regent Mayron.
Much. I am in supportive of these principles, so I will be voting in favor of them. I do have one question for clarification. I'm looking at principles 1A and B, and my question is this. It says funds compliance with the Department of Education regulations and guidance. A, funds distributed to students eligible for Title IV financial aid. B, funds distributed to students who experience COVID-related expenses. My question is, if an individual, a student, is not eligible for Title IV financial aid, but has experienced COVID-related expenses, would they be entitled to reimbursement pursuant to these principles, or is both needed? Are they mutually exclusive, or do you need both in order to qualify for a payment under these principles?
Thank you. Thank you for that question, Regent Mayron. President Gable, will turn to you first, and then you.
Thank you, Chair Powell. Regent Mayron, I'm going to defer to Senior Vice President Burnett, who may need to phone a friend.
Senior Vice President Burnett.
Yes, thank you, Mr. Chairman. And Regent Mayron, these are Title IV funds are only available to domestic students of the United States. That's straight out of the guidance from the U.S. Department of Education. So it would be and. The interpretation we're getting from the U.S. Department of Education, it's and, not or.
And if I may, Chair Powell, thank you. We have, Regent Mayron, the Student Emergency Fund, which is separate from the CARES Fund, which is comprised of philanthropically donated funds that do not have the restrictions that the CARES Fund has, which we've across the system distributed over $450,000. We do not know if there are students who weren't Title IV eligible who received those funds, but those funds would not have the restriction that the CARES Fund Act has.
Thank you.
Does that, Regent Mayron, that answers the question?
It does. Thank you very much.
Okay, thank you. Regent Davenport.
Thank you, Chair Powell, and I would like to weigh in support of accepting the CARES funds based on the principles that were affected. I'm not a lawyer, but I have experience and training from the Office of Management and Budget and worked with a number of various, I guess, technicalities related to higher ed federal funding. And I have confidence in our ability to meet the obligations that are set forth. Thank you.
All right, thank you. Let's see, Mr. Steves, I think everyone who wants to speak has spoken. I don't see any other speakers. Do you agree?
I agree, Mr. Chair.
All right, so then let's move to the vote on the principles for allocating federal CARES Act. And I'll just, before we go to that vote, I'll just say everything's been said very well. I'm very supportive of this as well. So, Mr. Steves, if you'll call the roll.
Mr. Chair, on the principles to guide the distribution of the student portion of the CARES Act funding, Regent Anderson. And I believe Regent Anderson is absent. He needed to leave the meeting.
Okay.
Regent Beeson.
Yes.
Regent Beeson votes yes. Regent Davenport.
Yes.
Regent Davenport votes yes. Regent Herr.
Yes.
Regent Herr votes yes. Regent Hsu.
Yes.
Regent Hsu votes yes. Regent Kenyanya.
Yes.
Regent Kenyanya votes yes. Regent Mayron.
Yes.
Regent Mayron votes yes. Regent McMillan.
Yes.
Regent McMillan votes yes. Regent Rocha.
Yes.
Regent Rocha votes yes. Regent Simonson.
Yes.
Regent Simonson votes yes. Regent Swigum.
Yes.
Regent Swigum votes yes. Chair Powell.
Yes.
Chair Powell votes yes. Mr. Chair, there are 11 in favor and 1 absent.
All right, that motion carries with 11 votes. Thank you. And I think we all recognize that was actually a very important discussion. I'm glad that we were able to bring it back up here, and I appreciate everyone's patience in going through that in the detail that we did. We'll move now to old business. Is there any old business to come before the board? And please, if you have any, either use raise hand or text Mr. Steves. I don't see anything, so I'll move on to new business. Is there any new business to come before the board? And again, you can either text or use raise hand. And I don't see anything. Mr. Steves, do you?
Mr. Chair, I believe Regent Hsu is seeking to be recognized.
Okay, Mr. Hsu. Regent Hsu.
Yes, thank Thank you, Mr. Chair. I do have a resolution I'd like to present related to athlete welfare. And I guess I don't know how to distribute it. So should I send it or should I just read it?
Mr. Steves, I'll look for your advice. I'm inclined to say let's start with reading it.
Mr. Chair, yes, I believe the best at this point would be if Regent Hsu could read the resolution and then also email it to us, because we'll need it electronically as well.
I think I typed it up. Mr. Chair, thank you. This is a resolution related to the support of emergency college athlete public health COVID-19 relief. Whereas the Board of Regents board is a member of the NCAA, and whereas the athletic association rules may result in the punishment of vulnerable college athletes who receive food, shelter, or assistance with medical or educational expenses. And whereas increased unemployment due to COVID-19 jeopardizes the financial stability of college athletes who rely on support from home and part-time employment to pay for necessities, medical coverage, and educational costs. And whereas financial shortfalls among colleges caused by COVID-19 could result in the reduction of college athletes' medical coverage, athletic scholarships, and support for necessities. And whereas the NCAA granted a blanket waiver allowing colleges to decrease financial aid amounts to college athletes. And whereas eliminating barriers to basic necessities for Minnesota students is a vital interest of the University of Minnesota. Now, therefore, be it resolved that the board do hereby adopt the following resolution. The University of Minnesota Board of Regents calls on the NCAA to immediately adopt a blanket waiver to suspend any and all policies and practices that prohibit or discourage financial support from any source to cover food, shelter, and medical and other insurance coverage, incidental living expenses, and educational related costs for current college athletes and individuals who have signed a letter of intent to play intercollegiate athletics for a post-secondary institution until the COVID-19 crisis ends.
And is that making its way to us as email?
Yes, you can do that right. I'm going to send it to Brian right now.
Okay. My first question is there any is there a time sensitivity to this this resolution, given that we're at the very end of a 5-hour meeting? I don't think we expected this. I'm not sure we're in a position to really give it a good evaluation, which it surely deserves. Is this something that we can table? And so we all have time to reflect on it and and give it good due consideration.
Well, I think it's time sensitive in that the NCAA granted a blanket waiver that's effective on May 11th, and also the pandemic COVID-19 crisis has been going on for quite some time already, and there are students who are in athletics that have probably been affected already.
Yeah. Okay. Well, I think, Mr. Steves, that our first order would be to see if there's a second for this resolution.
I second it.
Okay. Motion has a second. We'll move on to discussion. I think Regent Beeson would like to kick us off.
Thank you, Mr. Chair. I think this is very poor governance to bring in a resolution that hasn't been previewed by the administration, not to speak of the fact that it wasn't interjected during the presentation of the athletic director. So I, you know, I don't think it warrants a long discussion. I would recommend we vote it down, and that the author speak to the administration after the meeting. And but we can't pass this sort of resolution without background and conversation. Waited until the 11th hour, I don't know, but I just think it's poor governance.
Thank you, Regent Beeson. Regent Rocha.
Well, thank you, Mr. Chair. I don't know that it's necessary to go to the to go after the author, but I think it is a fair statement to say that, you know, people would like to have a better opportunity to understand it and be able to get an administrative response to it. On the merits, as I understand it being read, I would not support it in the current form. I don't think that it should be a wide open enterprise. I do think that there would certainly be merit in reaching out and taking a position that the institution would be in a position, the university would be in a position to provide support to students, student athletes who've been affected negatively. We do have it through other means, and I would expect that, and I guess we don't necessarily know because there's a lot to unpack here, but even with CARES Act money and other opportunities to provide support as an institution, the problem is where that crosses over and potentially would affect eligibility for students. So I think it's an important issue. I do think that it would be appropriate for the NCAA to take a position to allow institutions to provide support in this difficult time under these circumstances. But as that stands, I would not support the resolution in its current form, and it would at this point plan to vote against it. Although I certainly would be open to a continuing conversation, as the chair has referenced a moment ago. But I think appropriate intent, overly broad in its effort to address it. I think it opens a Pandora's box to outside folks providing unregulated resources to athletes, which is always a danger. And so I would not support it as it's written. Thank you.
Thank you, Regent Rocha. Are there other regents who would like to comment? While waiting, I would just say I also think that this is an important issue. I just don't feel that I am personally in a position to really fully evaluate it right now. And so I'd be very uncomfortable doing that without having some time to let the administration have a look at this and really think it through. So I will oppose this. I see that Regent Hsu would like to speak again. Regent Hsu.
I guess our board staff is not doing the unmuting anymore, so I'll do it myself. But thank you, Mr. Chair. I respect the fact that there are people that have a hard time with the fact that I'm bringing this at this particular moment. But this is kind of an emergency measure, and it really isn't a policy. All it's doing is asking that we exercise our duty as a board member of the NCAA and also as a university who has student athletes on campus who are probably and have been suffering through the pandemic. I mean, the current rules restrict, I think, even someone from giving toilet paper to a student athlete. And I think if all I'm asking here is that that we send a message to the NCAA as a member that asks them to adopt a blanket waiver to suspend their policies that are affecting the athletes that they oversee.
So Regent Hsu, I mean, I'll give you. I think that all of this could, I mean, may very well be correct. My view is that we'll find out. But my view is that what we're hearing is that the board's not feeling in a position to really properly evaluate it now. Would you be willing to withdraw the motion, give everyone time to think it through, and then bring it back again?
Thank you, Mr. Chair. Certainly, I think we would have to wait until June over a month to do that. I would, if there's no appetite to to support this now, I would actually invite friendly amendments to it before the June meeting, and I will withdraw it if that's what you think is best.
Is there any other commentary on this? All right. So Regent Shu? Sorry. Sorry.
Regent Rocha is seeking to be.
Regent Rocha, thank you. Regent Rocha.
Thank you, Mr. Chair. I would propose as an amendment to the resolution a substitute all and say that based on the circumstances that we currently face, that the administration would be directed to provide a report back to the board at the June meeting on efforts available to the university to seek the ability to provide support for our student athletes that both assist them through this difficult period, but does not jeopardize their eligibility.
Is that an amendment or a different resolution?
It would, Mr. Chair, it would be taking a signal from Regent Shu of a way to address this, but and then also bridge what you're asking for, which gives the administration a month to or some time to address that specific question. That's essentially what it's a proposed amendment to the resolution, substituting what's in front of us with what I was trying to capture your language to address to explain to us what would be available to us to try to address this problem.
All right, Regent Rocha, can I ask you one more time to express that as a amendment to the motion?
And since
everyone can hear it.
Since it's recorded, I know I'll totally blow this, but it's a substitute all, replacing the resolution as read by Regent Shu with language that the administration is directed to provide the board with a report at our next meeting on efforts available to the university to seek opportunities to provide support to our student athletes during this difficult time in a way that reflects the challenges we are currently facing, but does not threaten their eligibility for NCAA competition.
Okay, I hear that and I understand that. And let me ask, and I'm looking for any commentary, questions. Could we not just ask the do we need a resolution to do that, or could we just ask the administration to do that?
Mr. Chair?
Yes.
I'm still on.
Yes, you are.
I would be fine with just asking them to do that. But I was seeking something procedural that would get us past it. So just try to take off your signal.
I appreciate that. Regent Beeson.
I don't know why we're singling out athletes as deserving to have treatment that the other 45,000 students around the campus, can't be considered for. So again, I agree. Let's just have the conversation with the president talking to the athletic department. Obviously, Director Coyle is understanding of this issue. I would guess it's got to be somewhere in that dialogue going on. But the resolution's completely inappropriate at this point, in my opinion.
Yeah. So what I would suggest we do is we honor Regent Shu's offer to withdraw his motion. We take from Regent Rocha's suggestion that we ask the administration to evaluate this issue and come back to us at the June meeting, and so we can address this issue, which is an important issue. So that would be my proposal.
Chair.
Regent Shu.
Could I respond to what Regent Beeson said? Basically, the intent of this resolution is to solve the problem that student athletes are not treated the same way as the 45,000 other students that he referenced. They cannot receive benefits in the form of food, et cetera, toilet paper from their neighbors and from donors and other people in the community. And that's purely the problem that exists.
I think that's an important point, and certainly this would be something that we would ask the president and her staff to weigh in on as we consider this, and sort of so we get clarification there.
Point of order. In hopes of starting a cascade of withdrawals, I would withdraw my proposed amendment to the resolution.
Thank you, Regent Rocha. Regent Hsu.
I will withdraw the motion if the president will consider the problem before our next meeting.
All right, Regent Hsu, thank you. President Gable, you've been following this, and I think that we're looking for an analysis of this situation. Is it clear to you? Do you think it will be clear to you and your team what you need to do to evaluate this and bring back to the board?
Thank you, Chair Powell. Actually, no, because while there are restrictions on what student athletes can receive, and there are some differences, and with full agreement with Regent Beeson's point that we care about all of our students in ways that require compliance. Lots of students have restrictions. We comply with all of those restrictions, including those related to student athletes. If anyone wants to support student athletes, they can donate to the university and we can distribute it using the rules of compliance and the very robust and competent compliance office. I don't understand why this is necessary as a result. So I would need some clarification before we could even undertake the evaluation that is suggested.
Okay. We're at a standstill, and I'd be happy to hear any suggestions on how to proceed from here.
Mr. Chair, perhaps General Counsel Peterson could be of assistance. I know his office oversees compliance.
General Counsel Peterson.
Chair Paul, I have sort of an incomplete report for you. I've just been texting with Jeremiah Carter to see kind of what he knows about the lay of the land here. And his initial report is that the NCAA has allowed a blanket waiver for institutions to provide aid necessary to student athletes. So in terms of how best to proceed here is that I think in conjunction with President Gable and Athletic Director Mark Coyle, we should firm up that territory and we can provide information to the board about the current status, because it does seem as if the NCAA has taken some steps in this unique circumstance. But, I say this is all sort of incomplete and preliminary at this point, and I'd certainly want to run all of that to ground. But, I would certainly commit to work with the president and with Athletic Director Coyle to get that information, as soon as possible.
Okay, thank you, General Counsel. Regent McMillan.
I was just going to say that the simplest procedural move would be just to vote, and that's what I'd do. But I'm open to other alternatives.
Okay,
but I do think we've had discussion and we can move on.
Yeah, Regent Mayron.
Thank you. I'm not. If Regent Hsu has withdrawn his motion, then that works for me, and it also works for me. General Counsel Peterson's observations and commitment to take a look at this issue, have a discussion with Athletic Director Coyle and the administration to provide us some advice and counsel at our next meeting on the issue raised by Regent Hsu. But I'm certainly not having seen his resolution and not fully understanding all the ramifications with it. If it remains as worded, I would vote against it. But my preference is that he withdraw it and that we let General Counsel Peterson and his office take the matter up with the administration and Athletic Director Coyle and his folks.
Thank you, Regent Mayron. Regent Hsu.
I was just going to say that works for me. Thank you.
Okay, very good. Let's leave it there. The motion is withdrawn. We're going to study the issue through the Office of the General Counsel and the President, and we'll come back at the next meeting. Thank you. Going where angels fear to tread, any other new business to come before the board? Seeing none and hearing none, this meeting of the Board of Regents of the University of Minnesota is adjourned.